officially open this public hearing at this time. And the second agenda item is welcome and remarks. We welcome all of you, and we hope that your presence and your participation will add value and also assist the public to understand what is our Department of Health is doing and how are they benefiting. I want to take this opportunity to acknowledge and greet the Honorable MEC, Medikeza Mashego, the acting HOD and the entourage. We want to greet the honorable members of the committee, the AG representative present here, the provincial treasurer representative here, the staff members who are here, the legislature staff who are here, all the people who are watching from different media platforms. You are welcome and good morning. The department that is appearing today is the Department of Health. And it is here to appear to the public in this public hearing to account on how they've spent the public funds. And Scopa is here to provide oversight by strengthening the accountability, transparency, and the integrity of the government and its public entities. Scopa derives its mandate from the Constitution of the Republic of South Africa, Section 114, 2A and B, which the Act stipulates that the provincial legislature must provide for mechanisms to ensure that all organs of the state in the province are accountable to it and play an oversight over the state institutions. It's again against that background that we are here as a committee and the department to ensure that indeed what the department has been doing is in the interest of the public. We account to each and every cent spent, and we also account on the compliance that we should at all times comply with the provided legislation. And we must also be on par with our targets as presented to the House. Scopa is having a responsibility to track the House resolutions and monitor their implementation. So we are here to say, based on the previous resolutions adopted by the House, we must also account on how far are you with implementing those resolutions. And we can achieve all these things through performance planning, monitoring and evaluations, which are critical elements in building a capable, ethical and developmental state. We can further achieve our goals through strengthening the internal controls of the department. And when there are deviations, consequence management should be institutions. We're still having a challenge which has been observed of compliance, even when we have very clear guidelines in terms of legislation on how we should manage our finances, on how we should comply with the legislation, but we still see the deviations. And we are saying, if we have got those guidelines, and we decide otherwise, to us, there's no excuse for non-compliance. For us, there's no excuse for non-compliance. It is deliberate. So, That is why we are saying the internal control must be strengthened, so that in that case, the consequence management must be instituted. We are saying we need to get our books right. The rents and cents must correlate. But to us, it is not only about the financial statements where you are able to balance or to say they are balancing. We are also interested in the issue of delivering services. Department of Health is one department that touches almost each and every family. So if we can't provide that particular service, we ensure that our hospitals, our clinics are in such a way that our people don't spend the whole day on a queue. There are medicines, there are staff who can assist them. So it will be a challenge, because it will also deteriorate the lifespan that we've been able to increase in the past few years. So the health is a key to any economy to develop. It is a key to any development of any country. So, and we believe that will start with proper financial management and accountability. So with those few words, we want to welcome you, MEC, and your entourage again, and hope that indeed you are prepared for this hearing, because it is live on the social media, it is live everywhere, and in fact, if we had a big hall, we were going to invite the people to come and listen to the department, so that they are able to hear if we are spending their monies correctly. But because of the limited space, we opened the media for them, for those who are able to connect, and we thank them for watching. We believe that they are representing many millions of citizens of Limpopo who were supposed to listen to you. Before we get into the next agenda item, we need to talk about some few housekeeping issues. That we have an introduction as the second item, the third item, sorry. But as and when you are going to speak, colleagues, for purpose of the people who are not in this house, who are listening, or some who are watching through different media platforms, let's introduce ourselves. Every time you are going to speak, you must introduce yourself. If you are going to speak 15 times, you call your name 15 times. So don't be tired to do that. It is in the interest of the people who are not in this world. And the other thing is that we are going to ask questions as we have sent you and you have responded. We are going to repeat the very same questions that we have written, now verbal, and we are also going to answer verbally. And then if there are follow-up questions from the committee, they will forward them to the MEC, and then you will respond until we are all satisfied that indeed we have done justice in terms of a particular issue. But we want to check with you, MEC, that the documents that we have received, the files that we have received, do you know of them? Have you signed them? Are you aware of these files that you, and the contents of the files that you have sent to us?
Okay, thanks, Chairperson. My name is Deketseng Mashego, MEC for Health in Limpopo. And yes, I know of the contents of the files, and I've signed.
Thank you very much. No, we are asking so that as and when you get into the contents, and we believe that we have briefings and all those things, but we just want to ensure that indeed the file that is coming from the department, and in that case, we really appreciate. So without any waste of time, we go to item number 3, which is introductions. Firstly, 3.1 will start with the members of the Scopa, starting with myself. My name is Esther Mukwele, the chairperson of Scopa. Thank you very much, and then we go to other members.
Thank you, Chair. My name is Jacques Smaller. I'm a member of this group project.
Thank you, Chairperson. Nina Lagakena Lawrence Mapolo, a member of Scopa.
Macholoni, sinalanga di nempumuloni tambeleni Colbert, member of Scopa.
Machete Pesi, member of this committee.
Good morning, everyone. Kobodi Maila, I am a member of this committee.
Good morning, Chairperson. Good morning, my colleagues. Good morning, Team Health. My name is Matlodi Caroline Mantata Marcela, member of this team. Thank you.
Thank you, honorable members. And let's go to the legislature staff.
Good morning. My name is William. I'm the committee coordinator of Public Accounts Committee.
Good morning, everyone. Elizabeth, the researcher for the committee.
Good morning, everyone. My name is Carol Sloan, Communication Services.
Good morning, my name is Caitlin Sala from the Legal Services.
Good morning, good afternoon. Our name is Communication Services.
Good afternoon, Budibari Milo, IT support.
Good morning, Police Service and Research Services.
Morning to Bapakala Peter, Office of the Chief Whip.
Morning, Chairperson and all members. Solomon, Communication Services in the legislature.
Good morning, my name is City Committee
Colleagues, if you can stand up so that we see you. Like I indicated that for the benefit of others who are watching from different media.
My name is Lerato Masich, Committee Services.
Thank you very much. Office of the Auditor General.
Good morning. My name is Klaas Mthongo, Senior Manager from the AG.
Morning, colleagues. I'm Puling Marokani, Audit Manager of.
Good afternoon, colleagues. Chris Stelman, Audit Manager, Department of Health.
Provincial Treasurer.
Good day. My name is Portia Semenya, the Provincial Accountant General.
Good day, my name is Mazari Makali, Provincial Treasury Financial Governance.
Good morning, my name is Madam Scopa from Legislative Oversight Subcommittee. Okay, thank you very much. MEC and your team.
Good morning. My name is Diegetseng Mashel, MEC for Health.
Morning, Chair and members, colleagues. My name is Madume Mawasha, DDG Corporate Services, currently acting HOD.
Good morning, Chairperson and members of the committees, colleague. I'm Justice Mudau, CFO.
Good morning, Chairperson, members, and colleagues. My name is Mudau, DDG Healthcare Services.
Good morning, Chairperson, members and colleagues. My name is Adesa Jumapwan, Acting Secretary of
The mic, please.
Good morning, Chairperson and members. My name is Rabirani Nechisao from Health Director Internal Control.
Morning, colleagues. My name is Mpeteli Matlatli, Community Outreach and Legislator Support, MEC Support.
Good morning. My name is Nchengezeni Muvango for Monitoring and Evaluation.
Good morning. My name is Untarato. I'm the Chief of Staff of the ANC.
Good morning. I'm Albeli Ravuruvuru, the Acting Chief Director, Clinical Support Services.
Absheli Nils Koman, Director Communications.
Good afternoon. My name is Kulika Lucian, Director Legal Services. Good afternoon. Michelle Bustos, Technical Manager of the Office of MEC.
Good afternoon. My name is Desmond Lope, Private Secretary to the MEC.
Good afternoon. My name is Nagini Kau. I'm the Director of Resettlement.
Good morning, Chair and members. My name is Abilo Kulwani. I'm the Acting Chief Director, Strategic Planning and M&E.
Good afternoon. My name is Mkateko Tafula. I'm the Chief Director for Human Resource Management and Development.
Yeah, thank you very much. We know each other now, so we'll continue with the business of the day. But before that, if there are apologies.
They don't know. It's honorable of staff.
No, we will present that under apologies because she was not here when we introduced ourselves. One of our members just in, Honorable Scopa. She was having some commitments, she apologized. And welcome back, Honorable Scopa. We also have Honorable Matomani who was here. She went to fetch a car. She'll be back. We also have an apology of Honorable Mabuja, who is busy with the examination. And I think these are the only three apologies that we are giving. And we have the request for a refusal by Honorable Maina because of the work that is required to do. These are the only apologies that we are giving from our side. Are there apologies?
Thanks, Chair. Everyone who's supposed to be here is here, but just to put it on record that there were changes within the department in terms of the acting HOD. The acting HOD is Dr. Ndwamato, who's away for 2 weeks, is out of the country. So hence the person who's in charge now is acting HOD, Mr. Mawasha. So I thought it should just be on record.
Acting.
Yes.
It must not be one acting. Yes. Acting on the acting.
Yes.
Acting. HOD. Okay, that is noted. Colleagues, like I've indicated, item number 4 is going to be questions and responses. We are going to deal with 2 financial years, 2022, 2023, and 2023, 2024. I think it should be on record that the public will be aware that they are dealing with 2 financial years, 2022 and 2023, 2023, 2024. So we're going to ask questions based on the 2 financial years, which is item number 4. We're going to request one of the honorable members to lead us with those questions, but as a matter of principle that we have adopted is that because most of the questions in the 2 financial years are the same, we deal with them simultaneously, summarily. When it is question 1 for 2022, 2023, it is also question 1 for 2022, 2021. In most cases, the answers are really the same. So that is the principle that we are going to follow in it today. So we are going to allow honorable members to lead with us. I'm not sure, do I go or raise your hands? Let me start this side this time with Honorable Matlodi Caroline Mantata Mahasela.
Thank you, Chair, for starting with me at least. Okay, Team Health and Honorable MEC, we've got questions for you. And these questions, as the chairperson has already alluded to, that they are from 2022, 2023, and then 2023, 2024. So as she said that they are the same, so we are going to do them simultaneously. So my question is, number 1, Honorable MEC, it's under resolution status and stagnant in the audit outcome. The executing authority the committee has noted the Department of Health Education has not yet implemented all the House resolutions from 2014, 2015 to 2020, 2021 financial years. Furthermore, the Health Department has been stagnant with qualified audit opinion with matters of emphasis since the 2020-2021 financial year to date. So the question is, provide the committee with the status of the implementation of the House resolution. I thank you. Page 19, okay.
Page 18.
B, why did the department fail to implement all the House resolutions for all these years? C, the last one. Why is the Department of Health stagnant? Stagnant in the performance of the audit outcomes. You must know that. It's crucial. Thank you, Chairperson.
The other financial year?
Can someone assist? 23-24, question 1, it says, it's about resolution status and stagnant in the audit outcomes. The executive authority, the committee has noted the Department of Health has not yet implemented all the House resolutions from 2014-2015 to 2020-2021 financial years. So the question is the same as the first one. Provide the committee with the status of the implementation of the House resolutions. Right? B, why did the department fail to implement all the House resolutions for all these years? So prepare yourselves to answer the questions. C, which measures did the accounting officer put in place to improve the audit outcomes to unqualified matters with no emphasis, with no theme? I think I'm done.
Okay, thank you very much, Honorable Mahasala. MEC?
Thanks very much, Chairperson, and let me just officially greet you, Honorable Chairperson of the committee, honorable members of the committee, the staff from the legislature, Office of the Auditor General, and Provincial Treasury, Team Health, everyone who's here, and all the public that is watching, we greet you. Honorable Chairperson, yes, indeed, we are ready and we have prepared the responses for the questions, and
Sorry, Chair, maybe I'm deaf, I don't know. I'm asking the MEC, the Honorable MEC, to just raise her voice, please.
Okay,
So, but Mawela, is it audible from the recordings? Okay, the recordings are fine.
Okay, thanks. I will then hand over to the acting HOD to take us through the responses.
Thank you very much, Honorable MEC, Honorable Chair and members once more. My name is Matume Mawasha, and acting HOD, the response to the question is as follows. In 2022-23, the first part of it relates to a resolution of 2014-15 relating to human resources management and compensation. The resolution required us to refer the irregular appointments to the PSC for investigation, Public Service Commission. We have implemented the resolution by requesting the PSC to conduct an investigation. The PSC, due to its capacity constraints, decided it would do a sampling, and there's annexures as was requested to each of these that I'm saying. And a meeting was held with the Provincial Treasury on the 30th of October to discuss the documents submitted for assessment to the PSC. The Treasury advised that we should rather report on all irregular appointments in respect of that year 2014-15, and that was documented on 13 November 2024. Therefore, we are in the process now of subjecting the total population, which is 2,700, to background checks. Now, the progress in that regard is as follows. 187 of those did not require qualification verification because they were positions at an elementary category. Therefore, only 2,513 require qualification verification. And of the 2,513, 393 results have been received through managed integrity evaluation, and no adverse findings were made in that respect. All appointments require background checks. Now, of the 2,700 submitted, feedback for 682 has been received. No negative findings relating to the requirements that are in the Z83 were noted, and we expect to finalize this by the end of this month. Now, there were resolutions relating to 2015-16, and that relates to significant uncertainties, and these are legal matters. Our response, Chair, because the question was about, the resolution was about expediting the resolution of the legal matters in our books. However, the legal matters are controlled by the courts. Dates for resolution of these matters are allocated by the courts, and most of the time, the court roll is clocked. In addition, litigants are responsible for the pace of the finalization of matters. To that extent, it is beyond the control of the department. Now, in terms of outcomes of lawsuits, we were advised by Treasury to provide reports only in respect of matters resolved by the courts, as opposed to the cumulative reports that would have included matters not yet finalized. And largely that would have been repetitious and therefore undesirable. Now, the report as by the audited litigation register and the prevention strategy was provided to Provincial Treasury, and in all those respects, the documents were subsequently collected by Treasury on 18 November 2024, and we are awaiting feedback of the assessment of the submitted documents by Treasury. And Chair, in respect of 2016-17, the response is largely the same, and I assume that in the spirit of the introductory remarks of the Chair, we need not repeat that, but if it is so required, we are willing and able to do so. The next matter in it relates to 2017-18 and key audit findings. Chair, the basis for our qualification in 2017-18, and this Chair and honorable members relates to the point about stagnation of the audit. The basis for our qualification in 2017-18 was movable assets and immovable assets. The department has now, in 2023-24, in respect of that year, has an unqualified opinion. Therefore, the basis for that 2017-18 qualification has since been resolved. Now, the audit report for the 2023-24 and the standards relating to the emphasis of matters therein is also submitted to Treasury, and we are awaiting for the outcome of the assessment by Treasury. Chair, 2018-19, the matter of significance uncertainties was still there. The report is again similar to the previous years, and we once again assume that we need not repeat reading that one. And then 2019 and 20, the same applies in significant uncertainties. And then there's the tabling of House resolutions in respect of that year, 2019-20. And our response is that in order to comply with the resolution, we submitted the report to the Office of the Speaker for tabling. The department then submitted evidence of that submission for tabling to the Provincial Treasury for assessment. However, we received correspondence from Treasury to the effect that they sought clarity on whether the evidence we provided was accepted by the legislature, and that was on the 29th of August. On 8 October, the legislature responded to Treasury to the effect that the only acceptable evidence would be the order paper. That would be the evidence of the tabling. And that was, the Treasury sent that response to from the legislature to us on 16 October 2024. On 10 October, the department has requested Treasury to assist with obtaining those previous order papers so that we can go through them and ascertain that which needs to be tabled by the former NEC. Now, Chair, the matter of tender irregularities in relation to the procurement of PPEs, that also is a subject matter for tabling, and the response in that regard is the same as what I've just outlined. Then there's the matter of officials conducting remunerative work outside of the public service. 28 officials did this investigation or were reported to have done this. Investigation was conducted by our risk management unit and completed on 12 April 2021. Consequence management chair has been implemented based on the recommendations of the investigation report by risk management. It was noted that during the investigation, the 28 officials identified as doing business with the state were referred to SAPS on the 7th of January 2021, pardon me. And again, there's the annex chart to that effect. And we are awaiting for a response from us, the Treasury, on the assessment of the evidence submitted. In respect of the year 2020 to 2021, there were two matters: regression in the audit outcomes and again significant uncertainties. Now, in that year, the department obtained a qualified opinion due to incorrect valuation of one movable asset. One. The department has since resolved the basis of the qualification, as I indicated earlier, and we have an unqualified opinion in 2023-24. And again, the report and matters of emphasis in respect of that year have been submitted to the provincial treasury, and we're awaiting an assessment outcome in that regard. Again, legal uncertainties, Chair, the response would be the same. Now, why did we fail to implement all the resolutions? Again, Chair, the first one relates to the HRM and compensation, and I've already spoken to the reasons, and it's substantially the same, followed by significant uncertainties, that is still the same, and key audit findings, again still relating to movable, valuation of movable assets, which have since been resolved, and that was due to capacity in the relevant office, and capacity issues have since been addressed through the appointment of two professionals registered with SAICA in Asset Management Unit in November 2022. Tabling of House resolutions and the report relating to tender irregularities in respect of PPE, the response would be the same, Chair. And officials conducting remunerative work outside the public service. The department has implemented the resolution for the 2018-19 financial year. The officials identified as doing business with the state were referred to SAPS, and consequent management has been implemented. We are awaiting assessment outcome from Provincial Treasury, and we are in the process of finalizing the investigation. It was delayed due to capacity constraints, which led to the backlog of cases to be investigated. However, the capacity constraints in the unit have since been addressed. There's again a matter of regression in the audit outcomes, which is repeating in respect of 1920. Again, we point to capacity constraints at the time, which have since been resolved, and as I indicated earlier, we've moved to an unqualified opinion which says the matters have been resolved. Now, there's a matter of underspending of the budget. Two of the three aspects that related to the underspending were resolved. However, the remaining resolution of the three was due to failure by the National Department of Health to submit invoices relating to a Cuban scholarship program. This is a challenge we face every year in getting the big invoice that has to come from NDOH in respect of this. Now, in respect of the lifestyle audit, the department conducted vetting through the State Security Agency, which includes a lifestyle assessment after receiving guidance from the Office of the Premier by virtue of Circular 13 of 2024. Why is the department stagnant? Chair, we've already indicated that we have now moved. We no longer stagnant. Chair, I think those were the questions. Thank you very much.
Okay.
And Chair Matume Mawasha, once more, 2023-24, as was directed by the Chair, this, in respect of 2014-15, the same matter relating to HRM and compensation was raised, and the response is the same, Chair, for the record. And 2015-16, significant uncertainties. Once more, the response would be the same. In 2016-17, again, significant uncertainties. As the Chair correctly observed, the answers are the same. And 2017-18, key audit findings in respect of movable and immovable assets, the response is the same. Significant uncertainties in relation to 2018-19, the same. And 19-20, significant uncertainties, the response is the same. And so is the response in relation to tabling of House resolutions. The response is the same. And tender irregularities relating to PPE, officials doing remunerative work outside the public service. The investigation was conducted by the Risk Management Unit and completed on 12 April 2021 as reported in respect of the previous year. Chair, 2021, regression in the audit outcome, our response would be the same. Certain significant uncertainties, the response is the same, Chair. In 2021-22, contingent liabilities, the same. Legal matters are controlled by the courts in terms of dates. Underspending of the budget. In the 2021 financial year, the department underspent by a total of 120 million. The amount of 45.2 million underspending on COE was due to employee benefits that could not be paid, emanating to prolonged and or delayed assessment of pay progression, grade progression, long service awards and translations. And then an amount of 73.5 million was again in relation to the Cuban scholarship program. Historically, the department received an invoice of approximately 100 million per annum for administration in relation to the Cuban scholarship program. To avoid inadequate budget allocation previously experienced led to the department borrowing 100 million from another department. A budget of 150 million was therefore allocated for the year 2021-22, of which invoices to the value of 41.5 million were paid. Now, the invoice for the administration was not received in 2021-22 financial year, hence the underspending, despite several follow-ups with the National Department to give us the invoice. An underspending of 1.3 million relates to procurement of EMS vehicles, wherein provision of price adjustment was made, which price adjustment did not materialize. Consequence management was implemented for the underspending relating to pay progression, grade progression, long service awards, and translation, the employee benefit element. The evidence of follow-up to invoices is annexed in respect of the Cuban scholarship program. Now, we are again awaiting Treasury to give us an assessment outcome in respect of those. Revenue management. I beg your pardon, my document. Page 19. In respect of revenue management, now to comply with the resolution, consequence management was applied to the chief director in respect of the chief director and the director responsible for debt management. However, Treasury had a different view on the person in respect of whom consequence management was to be applied. That is why a meeting was held on 18 November 2024 to clarify this matter. And that is also attached. It was clarified to the provincial treasury that the write-offs were done at head office. The write-offs are done at the head office, and that is why consequence management was implemented in respect of those individuals. We are awaiting for Treasury to give us a feedback in that regard. To comply with the resolution in respect of other reports, the department submitted reports to the Office of the Speaker for tabling. And that also, the evidence was provided, and the response continues in the same way as we did in respect of the tabling of reports. So is the report in respect of RWAP's chairperson and lifestyle audit. Now, why did the department fail to implement the resolution? Again, the response would be the same as provided in respect of the previous report. So is significant uncertainties and key audit findings similar to the previous one. 2 professionals registered with SAIC have been appointed. Tabling of House resolutions, including the reports in respect of PPE tenders, same response. So is officials conducting RWAPs and regression in audit outcomes and the underspending of the budget, lifestyle audit. Now, which measures did the accounting officer put in place to improve audit outcomes? Now, in this regard, we're talking about revenue management. The progress to date, Chair, is that workshops have been held with both revenue and human resources teams across the department to ensure that root forms are circulated to debt management to identify whether there are any amounts to be recovered prior to making final payments to exiting officials. And the department has also appointed case managers to address billing of clinical services rendered to patients. We are also participating in debt collection contracts entered into by the National Treasury. And we have systems in place. We're rolling out a patient verification system which links to the Employment Bureau and the electronic data exchange which interfaces with medical aids to ensure that we are able to collect the monies in respect of people that are employed and people that have medical aid. We have held quite intense road shows across the province in every district to ensure that there's a concerted efforts by responsible officials in the district in terms of revenue collection. The above has led to resolving of two. Okay, before that, the department is monitoring the progress on revenue in monthly meetings, and the above has led to resolving two non-compliance paragraphs relating to revenue management. The remaining non-compliance paragraph relating to revenue management was on employee-related debts for which the department is reviewing the process of debt recovery as we speak before employee benefits are paid out. Now, then there's the area of asset management. Section 38(1)(d) requires that the accounting officer for a department, trading entity, or constitutional institution be responsible for the management, including the safeguarding of assets, and so on. The progress to date, Chair, I need not read all of those questions, but it's safe to get to that point. Now, progress to date is that in respect of the maintenance of movable assets, the department is advertising and procuring assets with maintenance plans. That is in respect of medical equipment. The department introduced a panel of contractors and hardwares for maintenance of infrastructure. This is hardware for in respect of maintenance, that is where institutions can go purchase materials as opposed to always having to do a tender or having to go out seek quotations. This is where we can use internal labor and procure material from hardware. So we have a panel of hardwares. Now we are also implementing district maintenance teams according to skills and catchment area of each hospital. Investigations of movable assets that are disclosed as under investigations were finalized at the end of November 2024. The movable assets could not be located after the investigation were submitted for further investigation by the Risk Management Unit to recommend write-offs if that be found to be prudent. Page 51, yes. Sorry, Chair, my screen seems to jump up and down. Now, the investigations in that regard are in progress and will be finalized by the end of February this year. The steps to guide compliance with Treasury Regulation 16A 7.7 are included in the asset management policy of the department. There's also the matter of performance reporting. Specific information systems were not implemented to enable the monitoring of progress made and so on. Chair, the progress to date is that the department has implemented the following interventions. At a facility level, facility data quality teams that verify data quality on a regular basis, conduct file audits and reconcile data monthly are in place. Operational managers have been trained on various aspects of clinical operations. This was not the case before, including information management and data quality assurance. At the district level, departmental internal self-audit teams support facilities by verifying data quality on a monthly basis. At a provincial level, data quality feedback meetings are held on a monthly basis with the district to verify accuracy of his data, district health information system data, once data capturing is complete. That is after the 15th of every month. The department initiated procurement of a centralized health information system with functions to capture individual patient information as well as program-related information, thus eliminating paper-based registered monthly input from the input forms and patient records. However, the procurement was through the SITA in line with prescripts, which led to us failing to procure the system between February 2022 and June 2024, and this forced us to withdraw the request for procurement from SITA. The department is now exploring the health management system, HMS2, which is being implemented in the Eastern Cape as well as the Free State. And we were in a joint benchmarking trip there with other departments, other provinces. And we will then go for an in-depth discussion with the Eastern Cape on that. Chair, I think in respect of the first batch of questions for the 2 years in question, those are the responses. Thank you very much.
Thank you, MEC. In my opening remarks, I think I've indicated that one core function of Scopa is to trace the resolutions, the house resolutions. But I must indicate, MEC, that we are disappointed because these resolutions don't tell us the progress or the implementation. I have 3 common ways that I was still counting how many they appear. Advice, waiting, assessment. After every second paragraph, we are waiting for the advice from the treasurer. We are waiting for the advice assessment from the treasurer. What are you doing as a department? Because this is your responsibility. Are you outsourcing treasurer or are you co-managing with the treasurer? 2014-2015 resolution, still waiting for the advice of the treasurer. For the 10 years, 11 years, what was happening in the department for that issue to be resolved? The issue of the house, the tabling of the motion in the house. The house, yes, there was that recommendation, but what is that resolution? Because that was a Scopa resolution. It was Scopa which says, go to the house and report. If you fail to report to the house, but at least you must report to Scopa. To say we're still struggling with that thing, but the resolution, at least we are here. Again, if there is a report, it means there is progress. Why don't you give us that progress, which we are supposed to report to the house, which you have got difficult. At least if there was that progress to say, we are here, and last you said we must go and report to the house, we've got difficulty with reporting to the house. But there's nothing here. The only thing that we get is just, we are waiting for the advice. We are waiting for the assessment. Really is very problematic. And what we get in terms of progress is just the letters going to the treasury, coming back to you. But in some cases, you are talking about the report here. Those reports are not there as evidence that there have been something happening. Because it's only the evidence that will be telling us that at least you've been doing something. So we're just saying letters to treasury, response from the treasury to the department as to what is happening in between. That can only be expressed in the form of a report, which was supposed to be in the file, but it's not there. There's no evidence that there has been something that has been implemented. For example, on 2015-2016, under significant uncertainties, where you are talking about legal matters that are as a responsibility of the courts to give days there, but you are also indicating that the report, as per the audited litigations register and prevention strategy, was provided to the Treasury for assessment. Well, we agree that Treasury plays a very important role in the accountability ecosystem. But for oversight, you report to Scopa. So if there is a document that is with the Treasury but has never been to the Scopa, how are we going to come up with a resolution to present to the House and also to Treasury? Because we also present to the Treasury to say there is this resolution to Treasury. Make sure that you assist the department to implement it. So these are some of the things that I have observed, and I'm really disappointed that you are forever waiting. Your report is just waiting for the advice. I don't know what advice, because the resolutions are very clear. You just have to implement the resolution. If you are waiting for the advice, you could have said, we did 1, 2, 3, we did 1, 2, 3. And then when we arrive at this stage, we realize that we need an advice. So we wrote this letter. But here, we don't see anything that was done. We just go straight to the advice. I don't know, colleagues, here are the resolutions that were presented. But to me, there's no resolution, there's no implementation, there's nothing. Honorable Nkumuluni.
Thank you, Chairperson.
Honorable Maida, Honorable Smart, and Honorable Machit.
Thank you, Chairperson. My name is Nampumbuluni TC. Yes, like what the Chairperson was saying, the first question on the verification of the qualifications of the employees, I think it's happening during the 2014-2015 financial year. And just only a simple thing of the verification of the qualifications of those who have been recruited. I don't think it needs a scientist just to know that if these people are submitting this information, we have to verify it. It's in the public domain that maybe in the previous years, when Collins Chavan was still the Minister of Public Administration, there was a lot, about 80-something qualifications were not true. They were fraud from the fly-by-nights, colleges, and so on. But for the department to just accept the people without verifying their qualifications is not acceptable. And I think it's just an embarrassment. But however, every time any aspect or any assignment, you put a date of the 31 March 2025 that you are going to finalize that verification MEC. That is in page 6. In page 6 of your response on the 2023-2024. Just after you appear to this committee, that you are going to, the verification will be finalized by 31st March 2025. That is in page 6. Like the chairperson is saying, it's either you talk to the provincial treasury and so on. And at this stage, some of the people will leave the public service. Some of the people will pass on without this thing being resolved. Many years. I think it's not at any stage acceptable that you will utilize the people without knowing whether they have true qualifications or not. When there are some commitments or some exercise not done in the department, I suspect some will be related to these qualifications which are not verified. When you said lack of capacity, yeah, there will be a lack of capacity because there at your department sit the people who do not have qualifications, and until now, for those years, are not verified. And the other one is, I'm not going to repeat the correspondence with the provincial treasury. It's like you are just a sub-branch of provincial treasury, whereas you have the mandate. The other one is this one, the tender irregularities in the procurement of the PPE, which also you are exchanging the letters with the provincial treasury, with the speaker, and it took long to finalize these cases. And then I think if you do the spade work here in order to finalize this so that we get the proper answer rather than just exchanging letters. And the other thorny issue, MEC, is the officials who are doing business with the state. And I think it should not take a long time that if you just verify these people, there were a lot of correspondence there and so on. But for me, you should take action, straight action against the people who are doing business with the state. I'm not sure, but I think this is the department which has the highest number of officials doing business with the state, which is not acceptable. And then number 3 is on the consequence management. When the department obtain a qualified opinion due to incorrect valuation of one movable asset. I think when the CFO and the managers in expenditure or income and so on, when they are hired on the basis that they are the expertise in finance and in asset management. But just one thing, I don't know what action did you take against the CFO MEC on that one, because I think it's, although it's one aspect, but that is the aspect which the person holding the CFO position must know. And also I just want to get the clarity or the current status, just in page 18, that the amount of 45.2 million underspending on compensation of employees was due to employees' benefit that could not be paid, emanating from prolonged and delayed assessment on pay progression, grade progression, long service hours, and transactions. That is the current status on that one, so that we know. And the other one is on the underspending of 1.3 million, which relates to the procurement of the EMS vehicle. That it just take time because of the price adjustment. That is just in page 19. I'm not going to emphasize the others, but by merely a price adjustment, and then we have this underspending on 1.3 million. MEC, we must remember that our people are dying on the road because there is no emergency EMS. A lot of life is being lost. But if we just underspend this 1.3 million in a very, very poor province, where there are not enough hospitals, where people, when they drive people to the hospitals, they just die along the way. But because of mere price adjustment, then we have that under expenditure. This is totally unacceptable, and I don't think any other Nyamujezo or Nyamuope can accept this when people are just dying on the way, when the money is there not spent because of one little aspect, as simple as ABC. Chairperson, thank you for such questions to the MEC.
Thank you, Chairperson. Greetings to the Honorable MEC again, and Torich. Chairperson, let me first applaud the department for at least getting, unqualified audit. At least they've done something, but there are some things that, as Team Scopa, we are going to question them. The first question, Honorable MEC, is this: that I can see even today you brought a second acting HOD. So, hey, hi, Honorable MEC, for specializing, acting. So my question on that is that when are you going to appoint a permanent HOD? Because we can't, rely on acting actors. We need to do something about that. And then my second question, at least, the chairperson and even Honorable Nempumurun gone through it, but this one, it's about Scopa resolutions of 2014 and 2015. I think on that, Honorable MEC, you need to take, or you need to apply consequence management. That is very, very serious on officials who are not doing their work. That thing, our consequence management must be done. And this thing of always saying, hey, treasury that, treasury did, this, I think it must stop. Or o ka re ntho e nngwe le nngwe le khuta ka treasury. You even told the treasury that, if I'm not mistaken, or other resolutions are old, old. All the resolutions, let's not say it all. You can't just, you know, do treasury every time. Everything, when we read or when we go through your files, it's about treasury, treasury this. That must stop. Arsanya ko ko re le kutaka treasury. Le ba le se ba le so batho ba. Oh. Okay. Honorable MEC, we are not here to bite you or threaten. No. We are here to assist the department so that where you are now, you improve to a clean audit. Because at least we have tried from stagnant, qualified, and then until at least 2023, 2024, ladies and gentlemen. So we want you there. We want you to obtain a clean audit, please. Maybe the last one, no. The other one. I had the acting HOD talking about the Cuban a program of Cuban students. Is it still on? Just tell us if it's still on. It's budget. The last one, PSC sample 25 files about irregular appointments. I want to know, or Scopa, I want to know how far is the department with the implementation of the recommendations raised by the PSC. Maybe you can refer to page 24 of 76, 2023-2024 financial year. So, Honorable Chairperson, thank you.
Thank you, Honorable Maida.
Yeah, thanks very much, Chairperson, even if my question has been covered, but I just want to indicate to MEC that although you have inherited some of the issues from 2014 to 2015, we expect to see changes or improvement, as my colleague has already indicated. It will be very disappointing to hear that the department has an irregular expenditure of 1 billion, while the consequence management is not actually instituted. So we want to see action being taken against all those people, more especially those who were doing business with the state. So what I want to know, in as far as this issue is concerned, when are they going to appear to disciplinary hearing? Because I don't understand that we should wait for the treasurer. So this is not a duty that should be allocated to the treasurer. It is clear that these people has committed an offense. Therefore, they should be responsible. And it should be clear from the department or I can understand why these things are just happening, and at the end of the day, there is nothing that is being done. So this thing should end here. When you go out of here, MEC, make sure that those officials attend the disciplinary hearing, and we want to see the report for that particular hearing, whether there will be penalty recommendations. So, and then in train, our people are waiting for the services, but this department seems to be very slow in terms of making sure that service ya batho ba rena e ba gona. Well, MEC, it is your responsibility to make sure all these actions are being taken against batho ba senyang. Ke a leboha, ke a leboha.
Thank you, Chairperson. Honourable MEC, let me first give my disappointment towards how you structured your file, because you make reference to, and I'm going to give you an example, on page 7, you make reference to document 1C. And I'm telling you, I've been looking for 1C and B, and actually A and B. Yes, you've got the A something, but truly you can be a bit more professional if you make a reference, put slides there in, and make it easy for us to find those things. That's from a simple perspective. What is concerning for me is that I don't know if it's arrogance, stupidity, that when you want to ask the legislature, has the program been submitted to you and you want to go through Treasury on the resolution? I don't understand that, because it does go through the Speaker's office. It's you writing to the legislature and requesting any history of the legislature. The whole history lies there. Now, Treasury must go on. I simply don't understand why you need the vehicle of Treasury to go. Why you don't immediately just go straight. It's not that the Speaker will tell you, please go through Treasury and then you can ask me for information. Even MEC sits here. There's a direct line of information that can happen between the MEC and the Speaker. It is concerning. But let's just deal with systems that should be in place or not in place, and how it affects your monitoring and evaluation. Because you cannot monitor and evaluate if the systems are not in place. You do make reference about let's talk about the vetting process of people. Are you telling me that in the past there was no systems in place to vet people? One. If your answer is yes, there were no systems in place to vet, then it's concerning. But if there was a system in place for vetting to take place, then accountability follows across the board. From the people that does the interviews, because even them themselves, everybody has got a duty. Can't just leave it to the last block to do the vetting. But there is a vetting process that takes place in government to make sure that what is on the CV actually is on the CV. To say that nothing is wrong, I would just, you know, I can be difficult. These are all your qualifications and verifications, and you give me a breakdown. I will ask you to give me the report that indicates that. That's me being difficult. Where's the report? Do I take what you are saying here on the right is true? I should not. So a report that gives that indication that was done by who and what must be put forward. We talk about a lifestyle audit that has been done. Make reference about the security agency that has done it. So what's the outcome of the lifestyle audit? Who signed it off? Who was the commissioners of those things? How do I challenge that output? It's not in the report. It's nowhere indicated as an annexure. Not to say that I don't believe it, but we come to a space where we are with Scopa, where we are at the stage of accountability, and where we are at the stage of proof. I want to believe that we haven't got systems in place, because if you look at where nurses and medical staff has got a report on people that they see or that visits, I don't know what you call it, ARMs or whatever, all of those visits, that when the AG wants to verify some of those indicators, the ARTs, and it's not possible to determine that. But you don't talk in your road-out of a plan on how you want to address that. Because we work on an equitable financial system. The more you report, the more you could get money from. And we will, and watch my words today what I'm saying to you. You will not get more funding from National Treasury when we do the budget this financial year. So what is your option? Your options are, you've got to be more efficient with the resources that you've got. And you've got to sharpen your tools to improve those things. HUD, you made reference about the advancement of revenue collection, and you mentioned some of the headlines. Is your revenue strategy working currently? If you would put a draft there from, and let's leave the medical aids on the one side, but if you would look at those things, are we seeing a percentage uptake, and can we talk to some of those percentage uptakes without going into two figures for me to be able to stand here and say your plans are working or not working? Because if you can't convince me, we will have the same findings going into the next year, because the system then doesn't speak. Because you make reference that, and it's maybe a good acknowledgement to say you've got a problem with ROPS, and the problem that you've got is capacity to do the oversight of ROPS. Okay, you've acknowledged that. Now we've got to find another way to deal with it, or we need to find a way to streamline the process that medical personnel that does double work, or I understand the people that wants to do business with government, but then there is that arm of medical personnel that doing two things. Is there a direct correlation between your litigation and your maternal mortality, linking it to possible overtime, overwork? Have you done that sort of investigation, HUD, to determine that you don't burn the candle on two sides of the coin? What is concerning for me is that in your disciplinary process of holding people accountable, which I saw some of the letters not even being signed. I've actually seen them, and I can show you which one is not. I will make reference to it now. But there's one that's not even been signed by the director himself. It's just a blank piece of paper there. But you want to hold there disciplinary cases for maternal mortality. But maternal mortality sometimes happens because the parent of the child probably did not went to go and do enough visits, didn't do enough checkups, didn't look after herself well. You know, there are things that are not just within the competence of the hospital. And I'm not now speaking for them, but I do want to speak about a fair process. And a fair process is the following. If the person has died, there's a forensic report. And the forensic report is part of the disciplinary case that speaks to the negligence of the individual that's in your service. Then you can hold that person liable for the KPI. But if you want to chase statistics by saying, but you have not seen 1,000 people, or you have not get to the percentage of 2% or 1.9% and you're above the norm. And you did not provide the tools of trade by virtue of electronic calendars, efficient vehicle transportation, outreach programs for that hospital. How then do you hold that person accountable for that KPI? Is that fair labor practice? I would want to ask. And if it's not fair labor practice, then I would ask that the type of recommendations that you want to make and the type of trying to hold people accountable for that should be then reviewed in a way that, because you want people to work for government in a manner that is conducive. And I would argue that there's a borderline that might be crossed. I will conclude with one question. You said that your ROPS will be finished by the end of 31 January 25, which is already passed now. You indicate in your answer that ROPS investigations will be concluded by 31 January 2025. You did a small sample, and then the bigger sample, that was the deadline. So my question would be, have you concluded on that deadline? And you have written to Treasury on the Cuba Doctors Scholarship, and your deadline was also end of January 2025. I haven't seen a response that you actually written to them because it's not in the file. But my question simply put, has that been submitted as we are HOD? And if so, are you still awaiting response by Treasury, or where are you on that? Thank you, Jacob.
Thank you very much. Honorable Macheta, please let's just go straight, just not make presentations. Let's just go straight to the concern if you want to raise a concern and question. Honorable Macheta.
Okay, thanks very much. Macheta Pesi, member of this committee. Just to check how effective is your selection and recruitment strategy, which will then speak to the issues that were raised in relation to qualification and appointment. How effective is that? But also to how do we structure the relationship that exists between provincial treasury and the department? is that relationship that just exists, that is not regulated, and which, in my view, that relationship, one or another, should find expression in the regulations. And if in that process there are issues that are referred to provincial treasury that may take long without being responded to, is that really regulated, or is just a cordial relationship between the two departments? Because issues that have been raised central to the challenges that the department has is that there's that referral to provincial treasury, but at the same time there's no quicker movement in terms of responses and the issues that you would have thought that would have been dealt with. So I think we should be able to clarify that relationship, because it's at the center of the delays that we have in the department. But further than that, we should also appreciate that we've moved from qualified to unqualified audit opinion, which means therefore that if these other issues that are outstanding as a result of this relationship, that needs to be clarified once and for all, so that we are able to have a sense in terms of how we should be able to deal with this matter, so that we don't have cumulative matters that would pack on shelves for so many times, and that also have an impact on how the department should be able to perform its work. The question that one may have, it's in relation to your measures. And then the question would be, what is it that you have put in place to ensure that your achievement of planned targets are achieved or are met? Because there's a challenge that, as per the report that we have had, but also on the annual financial statement and your annual report, that there's no consequence management. Why financial statements are prepared outside the ambit of the relevant legislation, even that is detected. But from the side of the department, there's no action that has been taken to ensure that that matter is dealt with. So perhaps if we could be able to respond to those questions for now, we will be able to come with another questions, considering space and time. And thanks very much. Lawrence Mapolo, member of the Scopa. MEC, I think it was just a coincidence that the ACT was represented by ACT. It's just a coincidence. You can't even manage the flight to bring it back and all that. But all in all, I think it's an area which you need to go and deal with. My colleagues have said that. But also, I've got a very serious problem, especially the relationship between the treasurer and yourself. And most of the things when I look here, you're still waiting for the assessment from treasurer. And earlier on, before you came, I was quite crossed also with the area of treasury. I need yourself to go and correct yourself in that space. Because, you know, treasury is not here now. It's here as a state witness, as I put it now. They're here as state witness, and they're here. But earlier on, one was very much critical on treasury. Now, for you not to avoid that area of treasury always coming to your reports, because they've got their own sins also, you must go and correct that area. Do your own due diligence and quality assurance on something that you might make a submission of assessment that is automatic for easy to implement. On You see, I was quite put in place when they said your irregular expenditure indeed doesn't mean that's fraud. And I'm very happy MC on that one. Much as it can speak of billions, but also it speaks to laziness. You see, you need to identify that fraud and laziness, where it's located, and deal with it. If indeed it's laziness, it will be exposed in your investigation internally. There's only something that makes me worry also. To say the investigation and program by risk management was done on the 31st of January. Until to date, they say the consequence management will be implemented based on recommendation of investigation report and target date set for the 31st of March. Meaning from January till to date. We might come back, Chair, to say on the 31st of March, this was not submitted. You see, that's my fear of in terms of delay of implementation of decisions that affect our people. And the last issue, which I think was raised sharply by the AG, ill discipline. You know, you have had, I would say, you have inherited a rot within this department. You have inherited laziness, above all, even corruption. Now, therefore, I think it's a test, especially now we have improved from qualified to unqualified. We indeed appreciate that keep it up. But now there are issues that might create a problem in future. The rot, which is the non-rating or the rating of people, those that are making submission for others to be vetted, they must be vetted. You must start afresh and even vet those who have made submission to vet others. I think I'm well understood on that. And thank you for that, Chair. I think if there's any other questions, we will be able to raise. But the discipline of our staff component in our clinics and hospitals should be taken into consideration. Thanks.
Thank you, Honorable Makoda. Yeah, my fear is that most of the questions will be verbal because there are no reports. And you know, verbal presentation is very dangerous because it's subject to misinterpretation. I hope that we have noted, MEC, the concerns and the questions. For example, the tender irregularity in PPPs, which were supposed to be presented in the House, that report was supposed to be presented to Scopa. The investigation report by the risk, which was concluded on the 12th of April, where is it? Because we need to engage the report. The consequence management for people throughout the report, for example, for those who are doing business with the state or other people. For example, in the files, people are charged. You find that, if I can just give an example of few cases, charge sheet which was not signed, the charge sheet of Malachi, the withdrawal of the disciplinary case is in the report, but it's not there as a letter to the individual saying that you are withdrawing. It is just in the report of the disciplinary case. The hearing for Ratsake SS, there's no letter to formally say you are giving, this is the final written warning. We just find this in certain report, and we're appreciating that you have to do those reports. But if you are saying you are charging me, I must have a letter directed to me, and those letters serve as evidence that indeed that message has reached the person who was charged. So we have got Boma City, Pakwago, the notice of hearing was not signed, Pakwago, charge not aligned, not signed, and the we don't have evidence that these people ever received the charge sheets, or if they were charged, they appeared, their sanctions were given to them. So this is very important information that we don't just have to give them, to give us verbally to say, no, we gave them, we charged, he was guilty 6 months and all this. We must see where that person has received that particular sanction, sign for it that indeed is in possession of that particular thing. So these are some of the things that are missing and that are very critical. You know, if the file was properly arranged with all the information, I'm telling you, it would have been done now. Because we won't have many follow-up questions. The reason why everybody is having a question to me is that your report is not talking. Your report is silent. Because if it talks, we'll just say, okay, this is what happened, this is what the department has done, this is what they are waiting for. There's no question. And then we're done, we go. So for the fact that you give us the half information, it delays us. We'll leave here 10 o'clock because the information that we are supposed to give, you did not give. And you want to give us verbally, the way you remember it. And then in future when we say, but you said that, you said no, but I did not mean that. That was a recent application. So one fact, and facts must be written, it must be in the file. So what I'm proposing is that indeed they have presented their resolution. Their resolutions are not talking. We have raised questions. But I think they must go and rework the resolutions and support with documents. Support with documents. Because these resolutions will not give us a clear picture for us to conclude on them and to recommend further. Remember, we're still going to present the resolution. After all this series, we're still going to develop resolutions and present to the House. So we're going to find it very difficult to present the houses to the House where we're saying health is still waiting for the treasurer, and let them treasurer. We don't know whether we'll hold treasurer accountable for that or you do understand our difficulties, because we want to say something that they've done 1, 2, 3. So treasurer is still going to appear. We say treasurer, health has done 1, 2, 3. Why don't you respond to them so that they conclude or they completely implement that particular resolution? And you find that by the time we're going to present to the House, all these resolutions are implemented. So we're saying go and do with these resolutions in a way that we will be able to trace for you, because when you have got difficulties, you can also assist me to say, hey, assist that department to conclude that resolution. But in the state of this resolution, it's very difficult. And we appreciate that you have tried. But we are expecting that at least you are able to show the year of that resolution, the financial year, 2014-2015, the resolution number. In that year, it was 8 resolutions, you implemented 7. It's only 1 resolution that is left. And that is one resolution is not, it might not be resolution 1, it might be resolution 8 or 7 or 5. You must indicate it's resolution number 5 about the human resource management and compensation. What was the recommendation from Scopa? That we go and investigate whether there was vetting or there was verification and all those things. What did we do? We had PSC. The report is here, and I'm happy that the report is already here. And then from there, what is the recommendation of the PSC? That we take appropriate measure. And then we have charged 1, 2, 3. Here is the annexure for charge sheet 1, 2, 3. If you have done everything about that, then it means that resolution is complete. If you are still having outstanding charges, you say you have charged 20, we are still busy with 20. And it is a process or a progress item. And we'll be able to track that particular resolution, because we are tracking where is this resolution. at what stage? Is it at the final stage? Is it concluded, or there is nothing happening? What can we do to make sure that at least there's a movement, there's a progress in terms of implementing that sort of thing? I'm not sure, colleagues, if you can take that paper, I mean that procedure, because asking them questions, yes, we'll assist them, but will not assist us because we'll have verbal communication or verbal answers, which may not be able to assist us at the end of the day. But that does not deter them to respond to what we've asked. I'm just saying, on top of, as they are asking, they must also know that at least we want you to beef up this resolution so that we are able to know at what stage are they, except that we are waiting for advice and assessment by the regulator. Yeah. As you respond to the question, if you can respond, or you can also.
But Chair, can I just understand clearly? We respond to the questions that have been posed, and also your advice. I want to understand that it means would have to go and seek, like for instance, the letters that you are talking about, to say there was in fact a communication to the employee about the process that we've outlined in the report. So you want us to bring those letters and attach them on the file. So
what I'm saying is the resolutions are not clear in terms of implementation.
Yes.
For example, at least the one for the first one for the human resource, it is at least having a progress, because there is where you refer the matter to the PSC. Okay? The PSC gave you a report, and now where are we? We are where we have about 20 to 25 cases where they are charged here. Okay? But we still have outstanding. So can you see that there is progress? So other resolutions, there is no indication where you are. The only thing that you get out of that resolution is that we are waiting the advice from the treasurer, we are waiting for the assessment. An example of the resolution that you give them progress is the first resolution. I'm not sure if maybe I'm very clear. So I'm saying, towards concluding this, let's also indicate progress with other resolutions. That's like indicated which HRM and compensation. Where there was investigation, the investigation report is there. And then where the action was taken, there is evidence where indeed there was action. It's not that all the letters were not signed. There's others which were signed, which are compliant, but there are some few cases where they are not signed. But there is evidence that indeed the resolution, I mean the recommendation of PSC is implemented. That is where we are now. They are outstanding, but there is work that has been done. That is what you are saying. So I'm saying, if there are certain questions that you clearly can answer, yes, you can answer, but we know that documented will be receiving those progress on some of the resolutions that may not give them progress.
no, yeah, thanks, Chair. My name is Degetseng Mashero, MEC for Health, and thank you, Chairperson. We really appreciate what the members have raised, and let me start by just saying that where we need to do corrections, Chair, we will definitely self-correct, because it is important that when we come to the committee, we are clear so that committee members can be able to understand, and also members of the public. But it is worth mentioning, Chairperson, that some of the resolutions, yes, we are busy resolving them, and others were being resolved. But I just want to touch on what Honorable Member Lempumbulu has raised in terms of verifying the qualifications. That already is addressed in the file that we are having, that we are busy with that portion. A certain number of people were already being vetted, and we are still busy, which is the point that we are raising, that you are still waiting for the other portion. So I just wanted to make it clear. And Chair, on the issue of our workers who are doing business with the state, I think it's worth mentioning that they are case that has been opened against those members. We are busy with the investigations, but also we've alerted SAPS because we know that it's a criminal matter for our members to be conducting business with the state. So there is something that we are doing. The issue, the acting HOD, it has been raised by a few honorable members. We are also not happy with it. Personally, I'm not. And what we have done now, Chair, is that when I got in, we're in a process of appointing. There were already adverts and people who have applied. But when we were supposed to shortlist, we found we could not shortlist anyone. Out of the people who had applied, we did not have suitable candidates. So the route that I've taken is to go and headhunt. And I have completed my headhunting. We've got candidates that now we are just awaiting for the date for interviews, and then we believe we'll be having a permanent HOD which will actually assist this department to having acting on top of acting. But we can assure honorable members that we are on it, and in no time we will be having the HOD in the department. And then the issue of the file not being so professional, I think I've already addressed it. Honorable Smalley and Honorable Chairperson, we really apologize for that. We have tried our level best so that the file can be as it is expected by the portfolio committee. But we are learning, and as I've said that we will do corrections so that in future everything is done accordingly. And also, I'm noting what the committee is also raising as a concern, the issue of us consistently saying treasury. So I think on that one we'll also improve on it. But then I think I would also give the team that I'm with, acting HOD should also be able to call on others who would be able to assist in terms of answering the questions that were raised by honorable members. If you permit, Chair, thank you.
Thank you, Chairman. Dume Mawasha once more. Chairperson, I think the big one that was raised by several members is this repeated reference to the treasury. I think we need to deal with it and put it in proper perspective. There's a legislated role that treasury plays in this system of assurance of the work of the department. And I'm going to ask the CFO to outline that role so that it's clear why we're referencing to treasury at all times. Chief Financial Officer, if permitted.
Or maybe MEC, we understand that's why I mentioned it, that the treasury is there, it's in the accounting ecosystem. But what we are saying, we need also to be privy to the reports to say we are here, we have done 1, 2, 3. And where we are now, we are at a stage where we are still waiting for the assessment from the treasurer. But at least knowing what have you done before you wait for that assessment. I'm not sure, MEC, if you understand what I'm trying to say. We also want to be privileged by because this is a Scopa resolution. It's a Scopa resolution, and the treasurer must monitor the implementation of the resolution. So, but you can't not give us the progress and go to the treasury for assessment. Yes, once you are at that stage of assessment, but when you appear at Scopa, it is proper that you say from the period that you as this resolution. We have done 1, 2, 3. Now we are at the stage where now we are got legislation. We are having an assessment by the That is what you are saying. What is the progress? What have you done before going to the treasury for assessment? What was done? That is what we want. We don't say don't go for assessment.
I don't know how we put it, but sometimes I said, treasury is always here. You understand? And they are part of the department that must come also and give evidence here. Now, my concern is that, you see, it's like now Treasury. I don't know how to put it. But if they said we're waiting for the assessment from Treasury, I don't see how can we push them to an extent where they can even you understand? I think, Chair, we said go and clarify that area, because indeed in every report they'll say Treasury, and they've got a reason why they say Treasury. You understand? And now for us now to push it more harder, they will even lie here, because I don't think they can. No, I don't defend you, but you know I said it also to say the issue of Treasury, it becomes a big elephant in the house, and we might get that Treasury are the culprit. You understand? Let's wait for that Treasury to come here also and say the department are delayed by you, because for now it's like the Treasury are delaying, but both their deadlines. You understand? I don't know how to put it, but
no, I understand.
I'm not.
But what you are saying, when the Treasury comes here to say you are delaying Department of Health, we must be Department of Health has done 1, 2, 3. They are left with 4, which must be done by you. So what we are saying now, we don't know the 1, 2, 3. We only know of the 4, so that we are able to say Treasury deal with number 4, but knowing number 1, 2, and 3. That is what we are saying to the Department of Health. Yeah.
No, Chair, I just, okay, the Kezeng Mashiro MEC for Health, I just wanted to say, in this case, 1 is Treasury, the first step. So the progress report that we are giving is that we were supposed to send that report to Treasury for assessment. Then Bona, they would give us now to say, what is it that we do? That would be number 2. So that's the reason that it appears to say we are waiting for Treasury on this one that we're talking.
It's becoming very complicated because why is complicated? 2014, 2015 was in that one. That is why it's confusing me. If 2014, 2015 was still at step 1 and the advice of the assessment, then what I was thinking now is becoming is confusing me. My understanding now becomes very difficult. I thought I was saying, yeah, or maybe let's get Honorable and then Honorable Mahasel and come, and then we will turn to
Chairperson, you know, when responding towards the resolutions and the outstanding resolution, it's because of a irregularity that took place. And the removal of that irregularity requires you to do certain steps, which you now done the PSC, you've asked for the condolment, and then the condolment so that those things can be cleared. That's my understanding in simple. But in that assessment, if you're not going to take accountability, if you're not going to hold people accountable for their oversight in the vetting, i.e. written warning, i.e. suspension, i.e. a disciplinary case, it means that you haven't done the full value chain. If the report says that there were no financial losses, if the report indicates that there were financial losses and people shouldn't have been appointed, and it does, and it comes to a financial loss, then the PFMA tells you what to do. And it is the condolment report that you then submit. And it's for me, it is putting that in state. That's the one side. And we must not compare the two things, the treasury is the custodian. I heard what you said actually. But the audit paper, let me make it very clear, the audit paper does not sit with treasury. I was in the house when the reports were read by the various MECs. And let me tell you what it was. It was an updated report on the resolution status to say where they were, and they were supposed to do it every 6 months. And I can tell you, the various MSCs have only done it once. Only once. Hence, I know that this committee has taken a resolution to bring it on their radar for every quarter session to deal with it, so that we can somehow foster. Like, there's only one meeting. You don't have to look far. There's only one.
Yeah, thank you.
Thank you, Chairperson. I'm still Maklodi Caroline Mantata-Masela. Honorable Chairperson, with due respect, and maybe to give a suggestion, I was suggesting that, because I can see that now it's like now we no longer have direction, and we are busy with dialogue, and that is going to take a lot of time for us. I'm suggesting that let's give the department to respond in everything that we have questioned, and then when we are done, Honorable Chair, when they are done, then we can, you know, we can, you know, question them on what we didn't understand, or on what we are not satisfied about. But for now, my suggestion is that let's give them a chance to respond, and then we can take it there. Thank you.
Yeah, we said they're going to respond, but we also proposed a way forward in terms of ourselves to be able to trace them, because it's very important to know where these resolutions are. I gave an example of resolution which 2014-2015. Maybe if we can go back to it so that we get to what we want to say, what we want to say. This resolution was regular appointment of the public sector in the health, and the department submitted an irregular appointment to the public commission for investigation. Now the process now is starting. Where are we? Investigation. The Public Service Commission conducted an investigation on the 30th of April. This is a progress. Then from there, there's an annexure which is showing us the progress. The PSC also responded that due to incapacity, they would only sample. Is another thing. 30 October, the document was submitted for assessment. This is until we have seen they gave a report, which is here. This is progress. And that report had recommendations. And some of those recommendations were implemented in the form of consequence management. We've got letters in the file, even though some of them are not signed, but there is that another stage. The other progress, the PSC has also given the department to continue. The department now, you are saying, we are still busy with other verifications. That is where can you see that this is progress? And this is the only resolution that is giving us a picture of what have you done and where we are now. The thing that you are raising is that it took a lot of time, but it's showing that there was something which was done throughout the process. But the rest of the resolutions, you just indicate and say, waiting for advice. But what did you do before you go for the advice? That is what we are saying. We then said, the MEC at least also spoke, but we were acting on HOD to stop it, because I want to ask that by ourselves, so that when you respond based on the clarity. As you are also, if you are able to respond to the questions that was raised, and then we close this issue, we will await the progress of these other resolutions, so that when we deal with resolutions there are also the other departments where their resolutions were not just they could not give us that chance to conclude properly. So we are going to have a day or a meeting where we will look at, we may not give you a date to come, But if you think that your resolutions, because would have interacted with you on other issues that may even answer the resolutions as we go through it, if we think is fine, is implemented, we say no, it's fine. If it is properly outlined, we may even say in your absence, though this one is very clear, then we can comment further that they must do 1, 2, 3. That is the poster that you will propose.
Yes, I will hand over to the acting chair.
Thanks, Chair. Matomi Mawasha once more. I'm going to leave given the Chair's input, the first one, because it sounds like the committee is satisfied with that. And then go into some of the questions, and I'll ask my colleagues to deal with others. Let me start with the matter of employees conducting business with the state. And I think there was a question around how quickly we do this. And I'm picking on it because several members spoke to it. The information is obtained from the AGSA. And these employees have done business with organs of the state elsewhere. At times, the information does not come with specifics of precisely, such that you can precisely immediately charge a person. You must correspond with the particular organ of state and say there's an allegation that so and so conducted business with yourself and this is the information you have. Then they must respond to you. You must accept. That takes very long. Then you on the basis of what you receive, you either withdraw because there's clarification and you can see you have no case to put against that individual, or you proceed to charge the person, which is why, Chair, there's this report attached here, Annexure 1A7.2. And just to illustrate, on that report you will find people found guilty, there are dismissals, but there are also charges withdrawn on the basis of what I'm saying, because there would be clarification and so on. There would be people charged and acquitted. They would have gone through a process. That is that report attached there. So we are not leaving it. It is being attended to. It takes a bit of time because if you look at the institutions involved, it could be anywhere in the country and any organ of state in the country. So you have to write to all of them, and you depend on them on how quickly they respond to what you're saying, and so on. So that is just an explanation of why that element would take a bit of time. But as you can see, Chair, there's a report there that shows we are doing something about it. So there is action being taken. It may not necessarily lend itself to the sort of speed that would be desired. Now, then let me go speak to the matter of the Cuban students. The question was how many are still there and what is the budget? We have not been, as a province, taking more of the taking more of our learners in the province to Cuba. So at the moment where we sit, there are 2 students in Cuba finishing this year. Then there are 5 students that are local in the country finishing their 18 months in the country. Remember, when they come back, they have to reintegrate into the system in this country because the systems are not necessarily the same. So they have to complete in the country with South African universities. So that there are those 5 there, and only 2 in Cuba. And the budget is now 2.188 million for this 2024-2025. So that answers that question. Now, the question, another question was about the vetting and so on. I think there was a question as to from Honorable Smiley as to whether there was no system and so on and so forth. One of the things that you do is verification of qualifications. And in this period we're talking about, we're reliant on the South African Qualifications Authority, which had its own problems, and the turnaround times in that space was not the best. And you must juxtapose that with the need to make an appointment when you have to. It was a very difficult situation. In many instances, Honorable Smiley, you are competing with other provinces for very scarce skills. And the longer you delay, people leave you and go and take up employment elsewhere, whilst you are waiting for, unfortunately, that is why it's in the books now. We were between a rock and a hard place, if you can think of it, where you either lose skills because you're waiting for this process, or you move and keep the person here and service delivery happens, and the department is capacitated. So those were some of the challenges. Okay. Vetting also by the State Security Agency, also it's a process that is lengthy, elaborate, takes time. You are pressed to make appointments and make appointments within certain time frames, but you also have these lengthy processes that are not out of your own doing. That is why you see in the report, we're now referring to a service provider. So we've since moved away from that. The situation has improved. So that is that one. Honorable Smiley, that was the situation then. Now, there was a question whether there's a correlation between maternal death and maternal mortality and medical negligence cases and so on. I think if I got the question right. Yes, the claims that are. The answer is yes. If you look at our presentation at all times of the statistics, you will find that the highest number is always in the area of maternal health, obstetrics and gynecology. The biggest number of cases is in that space. Obviously, that then tells you of a correlation. So then you went on, Honorable Smiley, to say, is there a correlation with overwork? We have not done that research as yet. That there is a correlation with overwork, and there would be instances where the answer would be a straight no. If you look at the number of doctors that will be employed in a particular hospital, and you look at the workload of that particular hospital, there will be instances where the answer will certainly be a no. If you look at the rostering of the personnel that is there vis-a-vis the usage numbers of that hospital, the answer would certainly be no. So even though we haven't quite done a study as such, but we can very clearly say there are many instances where that parallel cannot be drawn given the numbers that we have at our disposal. Now, then attached to that, there was a question of accountability of our staff for negligence and that's the word that is used often. Some people will talk about medical malpractice or adverse events and so on and so forth. Which adverse events for me is a better description because it does not prejudge a matter. Now, there are many, there's a huge caseload on our books, but it does not, all of it translate to negligent matters. There are issues relating to the system itself that will need to lead to cases. There are indeed negligent matters, and so on and so forth. Now, we are in the process of a process that will lead to exerting accountability on the part of some of our employees for that. Now, it has to be a very careful process where you involve a specialist, and there's a session planned, I think, early April. Dr. Ibagwane will probably give us a date because that's in her space, where we are going to analyze cases where, and this is very important, there has been an outflow of money, either as a result of a court order or us conceding merit. You have to focus only on those because a lot of the cases, Chair, you are defending. You are defending because you don't believe there was negligence. You must appreciate that everybody tries their luck with the health department. Something happened at the RAF that has opened the floodgate this way. So everybody comes, tries their luck. So it is not all the cases that you need, and the size of this thing can be so alarming and can lead to errors, because it is not because of the size that we then need to jump into disciplining people. One, you're going to impact on their morale and their ability to continue to do work without fear. That is why you must focus on cases that have been decided, where we have considered merit. And in some cases, we didn't concede merit because in the end, you will find someone negligent. You may find the system failed the person that was there. So that is why this session is involving specialists who are going to analyze those cases and then advise us. On this case, yes, so and so can be held accountable. On this one, this person can be held accountable. If you don't do that and you start wantonly looking for culprits or people to charge, you will jeopardize your defense of the cases that are still on the books, because we are defending those matters. Because that record will simply be taken to court and you will fail, because you can't say I'm defending this side, but on the other side I'm disciplining somebody. So I think let me leave that one at that. Can I ask the CFO to deal with some of the other matters? I could come back on other items that we may not reach, and my other colleagues to also be ready to deal with other issues.
Thank you, Team HOD. My name is Justice Mudau, CFO. Honorable NEC, Honorable Chairperson, and Honorable members, I've identified a few issues that relates to finance. The first one that I identified talked to the issue of underspending of 1.3 million on EMS vehicles. And there was a question why, because we are poor of the poorest province and we experiencing high mortality on our roads and stuff like that. I would like to indicate that the 1.3 billion, just to give a bit of expansion, it was a budget which was meant to cover the fluctuation of the price of the EMS vehicles, which simply means that the order of those vehicles, which were 50, did materialize. We received those 50 vehicles. Fortunately, we did not, get an invoice which took that particular amount, which change. Because when we deal with these transversal contracts from National Treasury, we are always, informed that prices fluctuate. And as a result, you order a vehicle of 300,000 today, tomorrow is 304 or 5. And you must have that particular, budget available as and when delivery took place and when you are invoiced. That is what led to the 1.3 million understanding, and we had to disclose it as such. It was not an understanding per se, we could say it's a saving. Then going to point number 2, it was on irregular expenditure of 1 billion, wherein the Honorable Maila, I think when he or she come with this question, it was as if there was a loss that was incurred or suffered by the department. I would like to indicate that the 1 billion irregular expenditure that we are looking at here, it was as a result of 3 bids. It was security, it was also panel of contractors, as well as groceries. And those 3 bids, as we speak, value for money was received. It was the issue that AG identified the gaps on our specification, which we have to accede. They said, looking at your specification and your evaluation criteria, there is an element of subjectivity which you have to deal with. And as a department, we appreciated that. We have gone to an extent of making sure that our specification now they must be reviewed by another body as like Treasury to assist us in making sure that we comply. But when you look at the compliance in terms of service delivery took place, and we paid for the work that we have enjoyed as the department, meaning that there will not be any loss and money to be recovered as such. The other issue which was raised was from Honorable Smale. He spoke about advancement of the revenue, and he was asking as to whether when we look at the current situation, can we vouch that there is percentage uptake? And I would like to indicate that the answer is yes. If you look at the prior financial year and the current financial year progress report, you will appreciate that since we have brought in clinicians into the space to appreciate the issue of assisting us in billing all the clinical services that are enjoyed by our patients, we are billing quite significant amount as compared to the previous financial year. Secondly, even the targets that we are given by provincial treasury, because when provincial treasury looks at our dynamics in the province, they don't give us a target that deals with 100% of what you're billing, because they know that given the fact that patients are not denied services even when they don't have money, they give you a percentage that is reasonable, but the department is able to recover or to collect that amount of money that has been given to us as a target. And in the current financial year, Honorable Smale, I would like to indicate that we are going to even exceed the target. And we have been doing so even in the previous financial year. However, we would like to accept the fact that we are still having a serious challenge with the people that are receiving our service, because majority of them, they do not have money. And when you look at the current situation of our economy, most of our people, they've lost jobs. They do not have the capacity to pay. But we are doing our best in making sure that we conscientize them that the little that they could be able to pay will play a bigger role in the department, providing the healthcare services of an acceptable standard. There was a question about the issue of the structure and the relationship between us and Treasury. I would like to indicate that we've got a very good relationship and the structure is there. Unfortunately, one wouldn't want to be seen to be defending treasure, I think they have a lot, and also the capacity problem on their side, because they look at all the departments. So when we talk about having, referred, certain reports to treasury, it is the standard that says, first go to treasury. Treasury is the one that must give you a green light. When they've given you a green light, it's then that you can claim to have, done what is expected of you. Until they give you a green light, you don't claim to have done it. You just indicate what you have done. And we appreciate what the chair said, which means that we will also go to an extent of making sure that the very same thing that we have submitted to our provincial treasury must be shared with the Scopa in order to make sure that this matter is resolved. Coming to the issue of the PPE report, which the chair requested that we should have presented it to Scopa, I would like to indicate that this report was presented to Scopa in the year 2020-21, and it was the Scopa that took a resolution to say it must be tabled. So what was now expected of us was the tabling, which we reported to say we did submit to the legislature via the Speaker's office, and we also went to an extent of talking about all the challenges that we are currently experiencing, which we also learned that we can still go direct, instead of going via our provincial treasury. But I would like to also indicate that the reason why we work in collaboration with our provincial treasury, they are the ones who also advise us. As much as when they look at what we have done, they are the ones who tell us to say, this is the way to go. So we thought talking to them is the right way, but we also learned today that we can also proceed and talk to the Speaker on our own. I think I've covered everything that relates to finance. Let me allow colleagues to come. I'm reminded about the issue of the qualification as a result of one asset, and there was a question why action was not taken against the CFO. I thought Mawasha you will talk to that, because I'm the CFO. I would like to indicate that definitely, as the CFO, we have gone to an extent of taking action against those that were in that particular space of asset management. Given the fact that as the CFO, you look after everything which is under the ambit of finance. But whenever there are issues that have been identified by AG, like the one asset that we are talking about, it was at Mount Queen Hospital. Obviously, there were people who were appointed to look after those assets, to also go to an extent of carrying out what we normally call the verification, and also go to an extent of doing what we call the fair valuation in an appropriate manner, failure to which we were left with no choice but to go to an extent of making sure that consequence management is taken against them. We did that. Furthermore, we went to an extent of making sure that after we have done that, because the person who was responsible for the entire asset management decided to resign, we then recruited competent, true professionals, as we have recorded in our report. You'll see it as we proceed. I think it is also there in the progress that we have provided on the resolution. And that bear the fruit. That is why when we are talking today, the department managed to resolve that paragraph, and that led to unqualified opinion.
There's measures to achieve quality targets.
Units, the time to focus. No, we can give you time to focus if you can focus. Because Are you done?
No, another question will be answered.
Yeah.
My name is Mtewana Dombo. Honorable Chair, Honorable MEC and members, in terms of there was a question on measures to achieve planned targets. The department has commenced with accountability sessions in order to deal with areas of non-achieved planned targets, where we have direct sessions with relevant program managers and local area managers, and in some instances primary healthcare operational managers themselves, where facilities have been identified as poorly performing. We have commenced that with, for example, viral load suppression in children, and we have seen an improvement, for example, where at the end of the financial year last year and Q1 of this financial year, we were at 38% viral load suppression, and at the end of Q3 we had improved to around 70%. So those are some of the examples of what we're doing. As we speak, even the rest of the week, we have a session, an accountability session with the hospital managers themselves to deal with the indicators directly in that particular manner, where there are certain action points that they are expected to deliver. And those sessions are recurring, so it's not a once-off, so that we are tracking progress, and where we need a case-by-case report, we are able to get that particular report. So those are the measures. We have moved from making it a high-level monitoring and evaluation session into an accountability session. Thank you very much.
Chair, I think Madame Mawasha, we dealt with all the questions in this point.
Yeah, thank you for your response, MEC. I think we were able to cover almost all the questions, and we really appreciate that. But I'm not sure if there is a follow-up question. I think they covered all the questions and they were being clarified. But what we are still emphasizing is that we were not supposed to struggle or to talk for about 30 minutes if those programs were given inside the report. So go and update the report so that we are able to have records ourselves, and as we are going to do the recommendations to the House, we know that this is at which stage, because the danger is that if in the state in which they are, when we are going to sit down and do the 2023-2024 resolutions, they are going to be included. So the number of resolutions unresolved for you will still be high. So we must be able to keep our records proper so that the information is accurate. So if we can just rework those resolutions, be very specific. They don't have to be short, long. Even this report, your report with our report, it will not be as long as we don't have 78 pages for the resolution. If you are going to do what you are saying you must do, it will be less than that, because it's very specific. We have done 1, 2, 3. Here we are, we have submitted to TREDA. It ends up there. So that is what we are requesting. So as we summarize question 1, and we believe that there's nothing that needs to be raised for question 1 on resolutions. As we summarize, we are saying, like we are saying, let's go and be very specific in terms of what we have done, where we are. And then this will help us as the committee to trace the resolution. We'll know at what stage is a particular resolution, so that we know if we're still very far in terms of implementing it, or if there is an intervention, because sometimes we know that there are difficulties by the department to implement a particular a resolution where you will need certain intervention, maybe from Treasury to assist you. Maybe you have got a irregular expenditure that you are struggling with the condonation. The Treasury may come and assist you on all those things so that that resolution is completely resolved. On the other hand is that as a committee we resolved to have quarterly meetings where the purpose is to trace the resolutions. Looking at the resolutions that we are having, we spend half a day dealing with the resolutions. So we want in the next hearing, maybe we don't even have a resolution at all, because we will start to implement the resolution even before. Because some of the things that we are raising, that you are noting, we must start with them now. As and when we present them as resolutions in the House, already you have got progress. When it comes to you that here is the Scopa resolution, you know that you are halfway implementing it. So in our interaction with your reports quarterly, we'll be able to know that this issue has been dealt with. By the time we come to the next one, maybe it's only 1 or 2 resolutions. So we want to deal with the tracking and implementation of the resolution. That is what we should do. So there will always be communication between our administration and yours to make sure that update on this one, update on this one. Are you still where you in March? And you expect it from now up to June, this resolution status might be different because there is always progress. So that is all what we wanted to do, so that we fast track the implementation of the resolution. We are closing question 1 on resolution, and we believe that we have done justice to it. No questions. So the next question will be question 2, but I think before we go to question 2, there is lunch ready. If we can adjourn for lunch from now up to 3 o'clock, then we continue with the other questions. Thank you very much. The meetings then adjourn up to 3 o'clock. let's convene and settle. We are on question number 2 on irregular expenditure. So we are going to allow honorable members to pose questions and the Department of Health will respond. Okay. Honorable Faith Scopa will lead us with question 2.
Thanks, Chair. Greetings to the colleagues. My name is Faith Scopa, member of Scopa. Question 2 is on irregular expenditure. On page 307 and note 30 to the annual financial statement, the department incurred irregular expenditure of 800 million in 2022-2023. This is a recurring matter from 2021-2022 financial year. A, why did the department incur irregular expenditure of 816 million in 2022-2023? B, which process did the department follow to reduce the irregular expenditure? Provide a detailed report. C, provide a breakdown of the irregular expenditure in both the years. D, who are responsible officials? E, what action did the executive authority take against the accounting officer? F, what action did the accounting officer take against the chief financial officer and other responsible officials? G, which measures did the department put in place to prevent the recurrence of the irregular expenditure? Question 2, irregular expenditure, financial year 2023-2024. Executive authority in page 255 of the AG's report, the AG's finding revealed that an irregular expenditure of 1.3 million was incurred as disclosed in note 25 to the financial statements, as the proper tender process was not followed. This is a recurring matter from the 2022-2023 financial year. Why did the accounting office incur an irregular expenditure of 1.3 billion? B, why were the tender processes not properly followed? C, why did the accounting officer fail to take appropriate steps to prevent such expenditure? D, provide a breakdown of the irregular expenditure of 1.3 billion. E, who are responsible officials? F, what action did the executive authority take against the accounting officer? G, what action did the accounting officer take against the chief financial officer and other responsible officials? H, which measures did the department put in place to prevent the recurrence of the regular expenditure? Thank you, Chair.
Thank you, Honorable Scopa. Emerson?
Thank you, Honorable Professor. I'll hand over to Executive.
Thank you very much, Chair and honorable members, my colleagues. My name is Matumi Mawad. The response to the question is posed. I'm going to start with the year 2022-23. The response is as follows, and Chair, I'm going to move very fast to assist the committee to make the time. The regular expenditure relates to 3 contracts. The panel of contractors, this is a contract for the maintenance of facilities in the department, groceries, and security. In total, 2.086816 of irregular speech is declared was as a result of alleged non-compliance with SCM legislation and incorrect interpretation of SCM prescripts. Now, the details as follows. The department advertised the contract with the CIDB grading of 4, and AXA argued that it should have lowered the specification to allow companies at a lower level to also enter and participate, so that they are able to do minor works. AXA also indicated that the department should have considered the use of the CIPC as an additional measure to the central supplier database to identify directors who have interest in other companies which are not disclosed in the SBD4 declaration of interest. This therefore resulted in incomplete disclosure of interest by those that were bidding. AXA further indicated that the objective criteria for work allocation as per the bid specification was not clearly defined. Therefore, this resulted in unfair allocation of work. The department condoned minor administrative errors, and AXA indicates that the bid specification only stipulated that we reserve such right without specifying the requirements or conformities that were to be waived. AXA indicated also that the objective criteria for passing of the bid from the winning bidder to other appointed bidders in terms of the price and triple BEE is not clearly defined in the bid specification. Now, we have since enhanced the specifications in subsequent bids to take care of this. The introduction of an additional layer of quality review for both specification and evaluation reports before adjudication has been introduced. Training through formal workshop of bid committees has taken place at the beginning of each financial year in collaboration with Provincial Treasury. The orientation of the bid evaluation committees for each bid before undertaking its evaluation takes place. The department also conducted and finalized the determination tests and requested for condonation of the expenditure in line with the PFMA compliance and reporting framework. The regular expenditure that has not been condoned has been addressed in line with paragraph 5.7 and 5.8 of the PFMA compliance and reporting framework. And the annexures to support that are provided. And there is the breakdown of the irregular expenditure in both years as requested. The responsible officials in D have been stated. This is bid evaluation committee members for the panel of contractors, bid evaluation committee members for the groceries contract, and then the members in respect of the security one. And Chair, no action was taken against the accounting officer. The department conducted an irregular expenditure determination process and determined that the basis or root cause of the reported issue was the differences in interpretation of the prescripts. The department requested guidance from Provincial Treasury to ensure consistent interpretation of the prescripts and closed the matter. No action was taken against the accounting officer, the chief financial officer, it should say. The department concluded an irregular expenditure determination process, and no officials were identified as liable due to negligence. The reasons provided. The department has introduced a quality review committee that reviews the specifications and also inducts all bid evaluation committee members as stated above to ensure that all the members understand the specific specifications of the bid they are about to evaluate and they do so consistently. The Treasury assists with bid reviews throughout the year to assist with ensuring that bids are evaluated in accordance with the correct interpretation of the specification and objective criteria. Thank you very much, Chair. That is the answer in this year. And in 2023-2024, Chair, the amount in that year was 1.4 billion incurred as disclosed in Note 5. It relates to 3 contracts, the same contract. The regular expenditure was declared because of a finding of non-compliance with SCM legislation, again due to incorrect interpretations of the prescripts, and the same measures have been put in place, as I read earlier, which should assist in the process. The problem, nature of the problem is the same. Why were tender processes not properly followed? The bids in questions were recurring. That is, they were previously advertised in under those numbers. Now, the department had previously been audited on this, and no findings were raised by AXA. And then the department then follows the same processes as the bid to avoid introducing new problems. Because when you are audited in this 1 year and there are no issues raised, it gives you the comfort that things are fine. However, this was not so. We followed the same process as the bid before to avoid introducing new areas of non-compliance. After the current finding and recommendations, the department shall review its processes in line with the recommendations by AXA. Why did we fail to take appropriate steps? As indicated earlier, because the bids had been previously audited and no findings were communicated, the department decided not to take any action. Now the breakdown is provided, that makes up the 1.4, and the names of the officials who were in the various bid committees are also provided. Chairperson, no action was taken against the accounting officer for the reasons I've already communicated, same as with the chief financial officer. And the measures introduced are the measures I've also read in respect of the previous financial year. And thank you very much, Chairperson. Those are the responses to the question.
Yeah, thank you very much. I think this issue was dealt partially in question 1, but was dealt in detail in our briefing. Hence, the briefing took a long time, so we were able to understand what happened. But I just want to raise 1 or 2 issues. That you are saying the bid was audited, and the findings previously by the AG were fine. So you were surprised now on the same bid, now something is coming up. I'm saying, yes, indeed is understandable. But if, for example, I don't want to assume, I'm just making a statement to say sometimes you find that there was a mistake in the previous audit, and if it is corrected now, it can be an issue. If there was, obviously it was confirmed that there was. I'm just saying, if something was done wrong and then as we go, it is corrected. It should not be an issue. Two wrongs can't make a right. I'm talking because there were heated correspondence between the department and the AG about the misinterpretation. So I think in future, we just have to look at it and maybe get advice on that. Because previously it was like this, what changed now? So that they show you what changed. My fear is that if you have not gone to that end, now when you are going to audit, even if it is not this one, because this one is removed, how are we going to approach it? You may approach it in the previous one and you were disqualified again. Such issues need to be taken into consideration. And the last thing is that in your reporting, which causes the contradictions, of course, the attachment is very clear that you say there's no transgression. But as you are presenting, you are agreeing with the issue that there is a irregularity because of 1, 2, 3. In some way or another, in some cases, if you go through there's some way where you are agreeing. You even indicated the number of officials who are responsible. Responsible for what? Because there was no transgression. So these are some of the, if it was a court case, I'm definitely sure MC that this one you're going to use it. Because somewhere you say no, and then from there you continue to give information based on the questions that is an irregularity. I'm just questioning you sometimes. I'm not opening it for discussion. I'm just saying some of these things, if you go to court, that's why most of the cases from the department in court are lost because they are not tightened. So I was just giving it, and I hope honorable members that we were properly briefed, unless if you want to raise, and please don't make presentations.
No,
yeah. Okay. Please don't present any presentation. The presentation was made. Honorable Smart and Honorable
Chairperson, the Public Audit Act makes provision for the lodging of disputes, and it's clear that there was a dispute by the department and the AG, and then Treasury supporting the department and Treasury. You know, having a sort of on the same page without going into too much detail. My question then would be, was there a formal dispute lodged with the AG? And if it was, did it get to the attention of the audit dispute section of the AG? Because if I'm reading right, it's like a category 2 dispute. So I'm just trying to understand that process of formalization. I get what you're saying, but that's all I just wanted to know on the topic.
Thank you, Chairperson. My name is Nempumbrum TC. I just want to only straightforward on it. You see, sometimes they can develop an element of suspicion because those bits were repeating, but repeating the bits if the AG did not discover anything wrong does not mean it is 100% right. I don't know, you are hearing me, but throughout your response here for all the pages, your reason seemed to be, no, we advertised it, there were no findings, then we did it like that. But there are some emerging and small suppliers who have been prevented to enter simply because of the the high requirements and conditions, where the AG is arguing that there are some minor things or maintenance which might be executed by the smaller company rather than those companies which are there. But again, the misinterpretation of the supply chain management again is not dwelling well with me, because we hired the experts to do that particular job. And throughout this submission, if there's no action taken, action also taken to the minor officials, like the one from Mankweni, the one asset. For me, the CFO should have taken the responsibility, because if maybe he has done the monitoring for all the assets submitted, then we should have maybe discovered that one asset is missing. I don't know the nature, but for me, the person stopped with the CFO. So it means that here, no action taken up against the HOD, no action taken up against the CFO, misinterpretation of the supply chain management, and also assume that if previously the AG is not finding anything, so it will be the same. I don't know whether the very same companies are coming in, or they are the new companies altogether. So if a certain company is coming back again and won the contract again, then I'm not satisfied. Thank you.
Thank you. As you are going to respond, the last thing is on the last page 41, that the department has procured services of an independent reviewer or to conduct detailed reviews of bids. My question is that with the budget constraints that we are having as the province, how do you afford to have an independent reviewer in this case? Yeah, thank you very much. MEC?
Thanks very much, Chair. My name is Davidson Mashel, MEC for Health and Labour. Chair, I just wanted to say yes, we'll respond to all the questions, but just to put it here that indeed the fact that the same process was made previously and there were no findings led us to this, of which we are not declining that now there are findings. That's why in the report it's saying that after the current findings and recommendations, the department shall review its process in line with AGSA, meaning that we have learned from this and now we will deal with things properly. And the reason that we are responding to all the questions is that we need to comply with the questionnaire that is here. That's why even when you check to say who are the responsible people, we are saying they are responsible because they were the committees that were working in that tender. So that's what we are saying. But yes, we have learned and we are correcting as the department. The acting HOD will then take us through the questions that we asked.
Thank you, Chair Mantumi Mawasha. Chair, I think the MEC has said a mouthful. One of the things that I would propose happens is that the researcher maybe must also just find clips of engagements with the previous committee. I'm saying this, Chair, in response to the issue of contradiction, that we seem to be contradicting ourselves, we're admitting and so on. Let me just leave it there by saying we are not to argue with AGSA. The other questions, I think the CFO can deal with. The independent reviewer, CIDB, that the honorable member has raised.
Thank you, acting HOD, honorable MEC, honorable chairperson, and honorable members and colleagues. My name is Justice Midao, CFO. The first question that I would like to respond to is the one that talks about whether we have lodged a formal dispute. And I would like to indicate that during the period of audit, The matter was only escalated formally to the PAG's office, and we managed to get the attention of the PAG who came in, and we then went to an extent of realizing that where we are, we don't have any option, even though we feel that because of the different interpretation, we have to allow that particular opinion from the AG to stand and go to an extent of dealing with the issues that we have indicated in our response, like training, bringing in the issue of probity audit, in order to make sure that our specification going forward will have addressed the issues that were identified by the AG. Hence, the chairperson indicated to say it's like you are contradicting yourself. It's because we first have to respond to the issues that led to this irregular expenditure. Furthermore, we didn't leave it as such, because if we leave it, it means going forward we are still going to find ourselves with those non-compliances. So we have to come in and make it a point that we do something about those issues that AG advised us, and we appreciate it, and that is what we've already done. Then when it came to the issue of the POC grading, the CID grading, the department, when they advertised the bid, they indicated that minimum CIDB grading that will be considered is 4. However, we also went to an extent of building into that specification that when you are now appointed in the department and allocated the work, you are expected to subcontract at the area of service delivery, suppose at an institution. When you go there, you're expected to subcontract depending on the amount of the project that has been allocated to you, meaning that CIDB 1, 2, and 3. However, that is what was not acceptable by the AG, and we accepted it to say in future going forward, we're going to correct it. Instead of leaving the responsibility to the service providers, the department will have to take over that responsibility, even though it will be now bringing more of administrative responsibility to the department. And as you know, the department size, we were trying to reduce number of contracts on our side, given the capacity that we have to manage those contracts. But we ended up saying we'll improvise. Coming to the issue of the independent reviewer, Honorable Chairperson, we found ourselves with no choice. We did what we call benchmarking exercise with the best provinces that are doing well at this point in time, like Western Cape. We also look at CETA. We learned that for them to, address issues of minor non-compliance, they've got what we call probity audit. And those are the independent auditors that you bring into your space. So we had to go to an extent of, advertise that particular bid, of which we have already concluded, we have already awarded at this point in time, to assist us in making sure that we should prevent irregular expenditure. And how did we go to an extent of getting the money? We have to reprioritize. We went to an extent of looking at our budget, and we went to an extent of making sure that what is it that we could compromise in order to bring in this element of internal control, in order to make sure that in future we do not have irregular expenditure. There was a question by the honorable member about companies, are they repeating or getting the work? And he is not comfortable if they do. I would like to indicate that in terms of the prescript, we are not allowed to restrict or to disqualify a company that might have worked previously and we advertise a bit today, they still win it today. In terms of the current legislation that we have from our National Treasury, we are not allowed to disqualify. If you still qualify and you meet all the requirements, you are supposed to be appointed. If we don't appoint you, it will be regular expenditure again. I thank you.
Yeah. Is there a follow-up?
Yes.
Okay.
Yeah, My name is Nempumlun TC. I know exactly that they cannot be left out by those pieces of the legislation. What I want to know is not a sin. Whether from those three, is there any company which again won the bid? There is no law preventing them. Yes, I understand. Exactly, I'm more than 100%. But my question is, from those security and those other two, is there any company which won again the bid?
Okay, thank you, Honorable. But I think the answer was sufficient, but it's fine. If they can answer you, they may.
That's it.
Thank you, Honorable Chair, Honorable Members. My name is Justice Mudau. We had 3 bids. We had panel of contractor. The one that is irregular, it is still on. We are advertising, meaning that we have not yet concluded the following one. Secondly, with security as well, it is on the pipeline. It's going to be advertised soon. We have not yet concluded. Obviously, we will not know what will happen. On the grocery as well, it's now on the evaluation stage, and we will not know what will happen as well. Thank you.
I hope you are satisfied.
Your remarks have prevented me from follow-up.
Yeah, I think if there are no questions with regards to this question, we are done and we can move to question 3.
Thank you. My name is Nempumluni TC. Question 3. The year ended 31st March 2023 in page 29, fruitless and wasteful expenditure. Executing authority on paragraph 45 of the AG was unable to obtain sufficient appropriate audit evidence that disciplinary steps were taken against officials who had incurred fruitless and wasteful expenditure are required by section 31(1)(h)(3) of the PFMA. This was because investigations into fruitless and wasteful expenditure were not performed. The fruitless and wasteful spending for the current is 313,000 2021-2022 and 403,000 recurring matter from 2021-2022 financial year. Question A. Why did the accounting officer fail to take disciplinary steps against officials who incurred fruitless and wasteful expenditure? Number B, in page 30, provide a breakdown of fruitless and wasteful expenditure in the current and the 2021-2022 financial year. C, who are the responsible officials? D, what action did the executing authority take against the accounting officer? E, what action did the accounting officer take against the chief financial officer and other responsible officials? F, which measures did the department put in place to prevent the recurrence of this anomaly? Now, going to 2023-2024 financial year, in page 42, fruitless and wasteful expenditure. Executing authority on page 208 of the annual report, the Department of Health fruitless and wasteful expenditure on the 1st of March 2024 was 230,000. In 2022-23, the department had an opening balance of 777,000 and was able to recover 677,000 and a write-off 109,000 recurring from 2022-2023 financial year. A, why Did the accounting officer fail to take disciplinary steps against officials who incurred fruitless and wasteful expenditure? B, who are the responsible officials? C, what action did the executing authority take against the accounting officer? D, what action did the accounting officer take against the chief financial officer and the other responsible officials? E, which systems did the accounting officer put in place to prevent the recurrence of this anomaly? Yeah, thank you, Chairperson. That is the last question.
Thank you, Honorable Mpumulun. Maybe before MEC, just want to acknowledge the chairperson of the Portfolio Committee, Honorable Chanima Devana. You are welcome, Honorable. I nearly forgot to acknowledge you because it's not that you have been here. So every time after any response, I thought I would acknowledge you, but you're welcome. MEC, question 3.
Thanks, Chair, and greetings to Honorable Malemane, the Chairperson of our Portfolio Committee. I will hand over to Acting HOD.
Thank you very much, MEC. Thanks, Chair. Chairperson, our response with regard to the question on fruitless and wasteful expenditure is that the accounting officer failed to take disciplinary steps in that there was a backlog in conducting determination tests of transactions dating back from 2016-17 financial year due to capacity constraints within the loss control unit. And the department has since commenced with the determination test on the transactions, and the breakdown is provided there. And B, the breakdown is further provided on the fruitless and wasteful expenditure incurred. The responsible official is stated as the Director Internal Control. No action was taken against the accounting officer as the determination test could not be finalized due to these capacity constraints within that unit. This disciplinary action can only be implemented once the determination tests have been finalized to establish whether there are officials liable for this fruitless and wasteful expenditure. The unit has since been capacitated with professionals to ensure the determination tests are conducted within 30 days. And no action was taken against the CFO for the same reason. In order to prevent failure to implement disciplinary action against the officials who had incurred fruitless and wasteful expenditure, determination tests are conducted in the month, that is within 30 days of the expenditure being incurred, to identify whether any official or service provider is liable for it. Districts and facilities that fail to provide the documentation for a determination test to be conducted are held liable for non-compliance with the PFMA reporting framework. The expenditure is also recovered from the officials that failed to finalize the determination test to establish the official liable for the interest. That is year 2023, 22-23, Chair. And in respect of 2023-24, the accounting officer failed to take steps because of the backlog in conducting determination tests of 123 transactions dating back to 2020-2021 financial year due to capacity constraints within that unit. And we are in the process of obtaining data acknowledgement forms for 8 of the transactions and are awaiting for responses from the municipality regarding the recovery of interest through reversal of interest for 7 transactions. For 15 transactions indicated as under determination, it will be finalized by the end of February 2025 at the time of compilation of the document. Chair, the information, the statistics as to debt recovered, written off, and duplicated transactions, etc., is provided on that table. The responsible officials are also named there as Sokole, Assistant Director, Capricorn District Finance, and so on and so forth in the various hospitals. On that list, Chair, there are also offices of the State Attorney, ESCOM, municipalities, National Health Laboratory Services, and Telcom. There are situations where, for an example, the State Attorney would have delayed in submitting an invoice for payment or failed to pay on their side because they have that responsibility. And then a sheriff will come when it is late, and there would be interest incurred. And why we will name them there, it's because they would have kept the information on their side, and no one on this side would have known of that information. Or in some instances, attempts at obtaining the invoices would have been made to no avail. And there are many other examples that can be given. No action was taken against the CFO because of the delayed determination test. And determination tests have since been finalized, and where officials were identified as liable, recoveries of the fruitless and wasteful expenditure in that amount were made from officials and service providers, 80817.98. Where the interest was written off, it was due to no officials being identified as liable for transactions relating to interest charged by the sheriff, for instance, relating to the example I gave earlier. ESCOM invoices received and payment due in between buyers' payment run dates. Interest charged by service providers such as ESCOM, municipalities, the National Health Laboratory Services, when payment was made on time. The accounting officer was satisfied with the action taken by the CFO. Now, as to which systems they were put in place to prevent recurrence, the payment procedure manual has been put in place to ensure that payments are made within 30 days, and the close relationships have been established with the Office of the Sheriff and attorneys on matters so that court orders can be received and processed within 30 days. Improved instructions of the State Attorney to pay tax bills. Recovery will be made on fruitless and wasteful expenditure attributable to State Attorneys such as interest, penalties, storage fees, sheriff costs, and any other related fees. To that extent, a dispute in terms of the intergovernmental relation framework has been initiated. A dispute against the Office of the State Attorney. To reduce the backlog on fruitless and wasteful expenditure under determination test and wasteful expenditure, determination tests are conducted in the month following, that is within 30 days, when the fruitless and wasteful expenditure was incurred, to identify whether an official or a service provider is liable as indicated. Chair, the response is the same from there on with the previous one. Let me pause there. And that concludes the response to question 3.
Okay, thank you very much. Thank you very much, MEC. Question 3, maybe as a start, I want to check on the first question on A, where you are indicating the capacity constraints, and you are unable to do the determination test of the transactions from 2016-2017. And we also acknowledge the breakdown of those irregular, fruitless and irregular expenditures, fruitless and wasteful. But on question E, sorry, starting with D, what action did the executing officer take against the accounting officer? You are also indicating the constraints, but you had a way of coming up with a solution. The unit has since capacitated with professionals, but you don't indicate it from when, so that you are able to assess from 2016, 2017, where was this issue, or when was it resolved? And you are also indicating that disciplinary actions can only be implemented once the determination tests have been finalized. But we are seeing in the breakdown there that you are having recoveries, we are recoveries in progress, we have got written offs as no official was liable with interest. If you can determine that this one can be liable, I think it's part of the determination. You determine that 182 and the value of 262 can be recovered and should be written off. Why can't you determine those who are responsible and who can take responsibility? That's my question, to say you were able to determine that this number of individuals, we are able to, this amount we are writing off because we can't attach it to any individual. To me, that thing is a determination. So when we further say you can't be able to have anybody liable because of the lack of constraints, determination, what. So it confuses me. That is why I'm saying, how did you determine with the return of in that amount? Yeah, maybe let me pause there. Honorable Small, Honorable Nampumuluni, Honorable Macheta.
Chairperson, if I may, just on the response C, you say that recovery has been made against officials, against 15, similar will be taken against the 15 remaining transactions. But what I'm just trying to say is, I'm just reading the number of people, 1, 2, 3, 4, 5, 6, 7, 8, that comes to 11. But we talk about, we'll be taking about 15 transactions. So I'm just trying to understand the 11 and the 15 because they don't add up. And I take it that you went as far as recouping the funds. But why not issuing out a formal letter to say you're now on a warning, that something like, why did that not happen? I'm asking because if it was so serious that I must fetch money from you, surely there's another step that you should have gone before. Just explanation, thanks.
Okay, thank you very much. Honorable Nampumuluni.
Thank you, Chairperson. My name is Nampumuluni TC. Just straightforward. When the unit has been capacitated and when the start date, the determination test has been conducted, when you start to conduct the determination test. Thank you.
Honorable Macheta.
Thanks, Macheta, as member of this committee. The issue of the
capacity constraint. And I raised this question earlier on, it was not responded to, that it speaks to your selection and recruitment policy or strategy. If you say in the evolution of things did not go well and you have to ensure that you get professionals to be in that unit, the question that arises is, at the time that others were appointed, because you have to make an ad in terms of that, you simply just get anybody without any relevant qualification to be in that unit, or what was happening. And if that is the case, that you have had people who have been appointed on the basis of their qualification, why they did not perform to the level that you would have wanted? Because I take it that in that internal unit, it may not be as easy that you could get anybody just to come and work. So in the course of things, you are saying you have to get other professions to fit into the space. So I think that picture should be provided to us so that we've got a sense. But in the main, one would also say perhaps that speaks also to the issue of the way in which training is also structured in order to respond to certain challenges that are there. Because it must then be informed by the needs. Are we able at a particular stage be able to conduct an assessment in terms of the capabilities that exist within that unit, or what is at stake? But just to conclude, there are various tests that are conducted to arrive at a particular diagnosis in order to lead to us to prognosis. What is this that we're calling it a determination test? If you are to put it in a very simplistic way to give a picture, what is a determination test? And what should characterize that test in order to arrive at a particular decision that this is what must happen? Thanks, Chair.
Thank you very much. As we are going to respond, the last one, MEC, I think there is a transversal issue of the bus run that most of the department incur fruitless expenditure because the bus run is not in line with ESCOM, municipality, and all those things. So we said as we go forward, as we are going to suggest to the MEC of Treasury and the Premier, maybe in your S committee, you also raise this issue, because if it is not resolved, all the department will have fruitless and wasteful expenditure every year, because the bus run is not aligned with the dates for payments. For example, if ESCOM is cut off date is the 7th, maybe the run for department is the 8th. So you will always incur the interest, because on the cut off date they always charge the interest. So I just wanted to mention that, so that you know that we have noted it and we have noticed it in all the departments. So if you can deal with those questions, what are the determination tests? How are they affecting these issues that we've been raising? When were they finalized? Because there's somewhere where they said, where you said finally they were concluded, but somewhere you were raising because of them we could not continue and all those things. So if it can be clarified, from when did you have this in place, so that you are able to relate before and even after, what is the process of dealing with these issues?
Yeah, thanks, Chair.
Thank you very much. I want to speak to the question around the capacity issue and the coupled with trading and so on. So, Chair, if we were to say to this committee that the recruitment and capacity development in the department has always been up to scratch, we will be lying. People come into the organization at different times. So there are employees who have come into the organization before this management team was in place. For that, I can't say at the particular time there was there were effective recruitment processes and effective capacity development programs. But sitting here where I am now, I can assure you that we will try our level best to secure people with the relevant qualifications. In this space, for instance, specifically, we're endeavoring, and we may not be successful all the time, but the endeavor is to recruit at the level of a chartered accountant. When we say, and the CFO will provide the dates, when we say there's been improvement in terms of capacity, few individuals have been appointed there, and the standard was at that level. And I'm saying again, Chair, we may not be successful at all times. And we do follow skills, training needs assessment as properly done through your performance management system and other needs as communicated, for instance, emanating from this kind of processes, and then conduct training as is required. There was a concerted effort, for instance, and it was labeled Project Clean Audit, and that the essence of that was an intense training program for not just the people in finance, because the audit issues culminate there, but they don't necessarily arise from there. So it was involving quite a broad range of leaders at the various levels of the organization, that project on financial management, on the supply chain, and so on and so forth. So we're making a concerted effort to ensure that one, there's recruitment of the correct people now, and the capacitation does happen. And capacity in this instance may also be referring to numbers. If you look at the volume of work, the years from which this determination test would have had to be conducted, the numbers would not necessarily have been up to scratch. The other issues, I think, are financial in character. CFO, please take them.
Thank you, Acting HOD. My name is Justice Mudau. Honorable Chair, honorable members, the first question, I think it was just to deal with the variance in terms of the numbers, wherein we reported 11 and there were also 15 transactions, and 11 was talking to the warm bodies. I would like to indicate that 11 was talking to the people indeed, but the 15 transactions were the ones that were not yet resolved at that point in time. Meaning that when you read that particular report that we provided, we were trying to send a message to say we had outstanding of 15, of which we have already resolved them at this point in time, and we have also got what we call the debt acknowledgement form, which has been signed by those that have been found responsible. Then coming to the issue of when did we resolve these issues of the determination, because we've been reporting the element of capacity constraints. Perhaps it would be prudent for me to comment by indicating that the loss control unit, which is under internal control, was always given the responsibility of looking at irregular expenditure as well as fruitless and wasteful expenditure. at the point where I will just now add on what the acting HOD indicated, we got, competent and professional individual. We had plus minus 2,000 transactions, which is inclusive of, irregular expenditure as well as fruitless and wasteful. So they had to commence by looking at irregular expenditure. And when they were working on irregular expenditure, obviously the transactions that were supposed to be looked at on the side of fruitless and wasteful were parked. Hence, we indicated to say, with the capacity we had at that point in time, we couldn't manage to do both. We had to prioritize, and if you look at the progress in terms of the assessment and the determination that has been done on irregular expenditure, you'll see a movement which start to indicate that within a short space period of time, whenever an expenditure has been disclosed or identified, it's subjected to that proper processes. So I would like to indicate that this particular process started around 1st of March 2022, and we started with irregular expenditure in 2022, and we then finalized the fruitless and wasteful expenditure in 2023. And the matter which, talks to the determination, what is this determination all about? Determination is a process where one would like to establish the facts regarding how the unwanted expenditure was incurred and who was responsible, as well as making sure that you then go to an extent of coming up with the appropriate action to remedy that situation. There was also a question about why are you talking about recovery, not even talking about certain processes that you should have followed towards recovery. When you talk about fruitless and wasteful, the moment you do determination, the next thing, if you find that indeed there's a person behind it who didn't do what was supposed to be done, you don't go for a warning letter. It's recovery. That is fruitless and wasteful. It's unlike irregular expenditure, and whereby you have received, value for money. But with fruitless, it's when you are saying this is expenditure in vain. Somebody must make good of it. Hence, we don't follow any other process other than recovery. And the last part, I think, we just want to thank the Honorable Chairperson having taken us to confident about the bus run, timing against ESCOM invoices, and that is what we are also facing as a challenge. I thank you.
Yeah, thank you very much. As much as you indicated that with recovery there are no processes, but and I've seen the letters, there are letters where certain individuals were given to acknowledge the debt. The department is very huge, and then when you have determined that a particular individual is responsible for a fruitless or waste, obviously there must be a letter, and then she must acknowledge, so that you are able to do the follow-up. You can't just say through a circular. Those who know that they have done 1, 2, 3 must make sure that, there must be formal communication. I think that is what we're trying to indicate, that at least there must be, and they must acknowledge. Because if you say to me, I'm responsible for 10,000, and I don't acknowledge as well, because I also have a right to say, no, I can dispute that, and if we've reached that stage, it be traceable. That is where I started. I wrote a letter. The individual came to say is against that, and then we took this process. I think I just wanted to indicate that it is important, and even for record keeping, and even for accounting, because when we are audited, you'll be able to account on this 1 million is because it has been recovered. But if there's no document or acknowledgement, you may not be able to know where is this coming from. So, but we appreciate that at least you are in the process of recovering. We've already recovered 663,000, and then the other 100,000 is in the pipeline progress, and then there is also progress in terms of the other one which is written off. Can you see that is progress Honorable MEC, this is progress. We know where you are in terms of the recovery of the fruitless. This one has been covered. This one in terms of, you know that there is 100,000, which you are still in the process. We are expecting that in the next process, then we'll be talking about only 100,000. We're not talking about the rest. That is when we give progress. That is what we are doing, and that is what we are really strict on the progress. I think if all the questions have been clarified, we can move to the next question, which is question. Before, maybe let's agree, because these questions they are no longer now the same. I think in question 4, 2022-2023 is something else, and 2024 is something else. So what do we do? Let me check 2024 question number 2022-2023. Can I be assisted, please? Basis for qualification opinion, maybe let's deal with it. Contingent liability, but it is in this financial year only.
Question what?
Question 4, 2022-2023. Yes. Honorable Macheta.
Thank you very much, Mr. Chair. Question 4. Basis for qualification opinion contingent liabilities 2022-2023. Executing authority in paragraph 35 of the AG's report, the Auditor General was unable to obtain sufficient audit evidence that claims against the department for the current and previous year had been properly accounted for. Due to a lack of documented consideration that corroborate how the most likely outcomes were determined, the AG could not determine whether any adjustments were necessary to claim against the department as stated at 9,30775 billion. 2022, 8,400,633 billion, as disclosed in note 241 to the financial statement. 4A, why did the department fail to provide audit evidence to AG on contingent liabilities for the current previous years? B, what is the current status of the contingent liabilities in the department? C, what measures did the accounting officer put in place to prevent the increase in the contingent liabilities? Those are the only 3 questions.
Yeah, thank you very much. In response to this question, question 4.
Thanks very much.
Thank you very much, MSC, Chair and members, colleagues. Matumi Mawasha. The department failed to submit the statements in accordance with the prescribed framework due to the qualification paragraph on contingent liabilities as a result of the following events. In 2021-22, AXA reported that the considerations relating to assessments of contingent liabilities were not documented in the form of an SOP. As part of the audit action plan, the department then prepared the standard operating procedure, which detailed the consideration in assessing the contingent liabilities as was advised. Then the SOP was presented to the Provincial Treasury and AGSA in February 2023. Upon receipt of the SOP, the AXA conducted a walkthrough on the SOP and no issues were communicated by AXA. In July 2023, the AXA indicated differences between the assessment of management and assessment by the AGSA. Now, we're moving away from the lack of an SOP to how the assessment is done. That's the new finding. The documentation of this consideration was provided in the form of a similar case. So the requirement was that you have to use a similar case to determine the quantum of the liability, contingent liability, in line with the SOP and the recommendation by AXA in the 2021-22 audit, indicating that similar cases should be identified and used for valuation. Now, the department had a meeting with AXA and the Provincial Treasury to revise the assessment methodology. The revised methodology has been accepted and audited. The new methodology and no additional issues have been reported. The summary of contingent liability on medical legal cases per category is as follows for cases lodged from 2005 up until 30 March 2024. The audit paragraph has since been resolved. Now, the measures put in place to prevent this from occurring, we have 5 main focus areas. We continue to train clinicians on medical ethics, clinical governance, and litigation in order to equip them to make them aware of especially the causes of litigation and what can be avoided. The training also focuses on proper creation, maintenance, and preservation of medical records. This includes the importance of legible writing by doctors. Wish us luck, Chair. Proper creation, maintenance, and it also focuses on proper creation, maintenance, and prevention of medical records that would enable the department to successfully defend cases where negligence cannot be established, or where, if established, damaged claims cannot directly be linked or attributable to the negligent conduct. Planned activities include workshops in the various districts. The department will also like to improve awareness of protocols and legislation applicable and their importance, including measures to exact some accountability for avoidable mishaps in treatment of patients by its employees. The workshops will further promote awareness of its medico-legal policy and strategy. The department is, however, still cognizant of the need to reduce occurrence of patient safety incidents and is continuing to implement the policy. A process of implementation of the strategy and policy is underway. There's an annexure there that details the progress made. In the assessment of cases within the contingent liability register, the department has realized that the register consists of genuine cases as well as opportunistic cases. I've said this earlier. The opportunistic cases are eliminated through successful defense by a strengthened legal team, as well as internal, as well in the external service, which is the Office of the State Attorney. The department engaged in a special and protected process of evaluating its portfolio with the involvement of specialists, clinicians, and legal officers together to make determination as to which cases to proceed to defend and which to resolve via alternative means. This, the Department Trust will ensure that only defendable cases remain on the register, while those capable of amicable settlement are dealt with earlier and settled out of court. However, the above interventions, the vigorous defense, are rendered futile when the external legal representative compromises the cases. The current state is unfortunately that the Office of the State Attorney cannot be relied upon. Some cases are lost unnecessarily and the department is left with financial loss as a direct consequences of representatives' unreadiness. E.g., a 31 million default judgment case, we experienced that. Owing to our failed attempts to secure a meeting with the Solicitor General, I must hasten to say at the time of packaging this document, that was the case, but subsequently with the appointment of the acting Solicitor General, a meeting was held and processes are underway. The processes underway are to discuss this that we say we wrote to that office, as well as the Office of the Premier seeking permission to outsource the service and appoint private law firms, but also to discuss why we should not recover the losses instanced by the failures of that office. The department is also cooperating with the SIU in the investigation of alleged allegations of losses made in respect of affairs of the national and provincial departments of health as per the proclamation 74 of 2022. Chair, that is the response in respect of the year 2022-23.
Yeah, thank you very much. Department of Health is one department which is a victim for a lot of litigation. And we are aware that this was raised in other committees. Remember the effectiveness of the state attorney in dealing with cases within our departments. So here it is very clear that indeed there's no value for money, like we've always said. And you also, the annexures there indicate where you go to the Premier, but I don't remember seeing any response to give you a go ahead to say you can, because I think for us, for the government to have a state attorney, it is also controlled by certain laws and guidelines. So you can't just say, no, I no longer, this one is failing us, but I think it should be raised as a concern, as it has been raised by other departments, or as it is evident with other departments, where we know that the department will never lose it, will never lose the case. There are very few cases that can be won. That is why we are always questioning the capacity of the state attorney. Is it capacity constraints, or is that there's no value for money? So I think we are noting this issue here as state attorney, that the department is very vocal, is saying clearly now that the state attorney cannot assist because we incur a lot of costs, legal costs, and also the interest and sometimes if you lose a case, you also have to pay the person who took to court or who took you to court. So this is also noted. Colleagues, do you have questions on the issue?
Yes, mine I think, Chair, would be sort of a comment because we have to look at the causes and be able to deal with that and advise accordingly. You see, for instance, when they are probed, they'll tell you about budgetary constraint before the state attorney. Budgetary constraint in terms of filling of vacancies and also the question of appointment of incompetent people. That's lack of capacity. And I think that leads to to this kind of problems, if we can be able to deal with the two, I think within the department we'll be able to cap most of these problems. Mine was just to advise to say, let's deal with the budget. Where there's lack of budget, we have to assist also to say, in this area we have to assist the department to close that area. Capacity, yes, we need to up our game also and make sure that not only training, retraining. You see, because those that are within might also have a problem in loss of memory. Now, I think always we have to retrain our officials to make sure that they deliver. That's my humble submission, Chair.
Okay. But the other thing is the issue of the standard operating procedures that you submitted to the AG, but later on the 13th of July 2023, the AG indicated the differences between theirs and yours, but you did not indicate those differences and what impact. What was the implication of those differences in the management, assessment of management and assessment by the AG in terms of the standard operating procedures? I think those would be the comment and the questions that we are. So let me see.
Yes.
Thank you, MEC and Chair, members and colleagues. There was in Matomi Mawasha, there was a response from the Office of the Premier. Firstly, the Office of the Premier sought a legal opinion from the Office of the not Solicitor General, the Chief State Law Advisor, and the opinion was actually based on our assertion, Chair, that in the proper reading of the State Attorneys Act, we are not obliged to use state attorney. To go to, this is our assertion, we actually had a subsequent meeting with the Office of the Premier where we were saying to go to that office to seek a legal opinion is to go to the same person we are complaining about. But we did not stop there. We went on to show Office of the Premier that the opinion they sought conveniently skipped certain sections of the law that enabled us, that very clearly say it is optional at a provincial level to use the state attorney. We read that together, and they then wrote a subsequent letter to the Office of that person again, Chief State Law Advisor, in which letter they are saying they see the point we are raising, seeking a further response to that which we also then went around to check other state departments that are not using state attorney, and we found they are there. We had meetings in the Free State and in Gauteng. In Gauteng, it was with a number of departments and so on. We found there are people who are not necessarily using state attorney. They read the law as we do. We're still convinced that we are correct in that reading. It is obligatory at a national level. Now, even there, you still find others that do not use it. And in some cases, it is by agreement with state attorney, etc., etc. Now, so we are not proceeding recklessly, willy-nilly. We're proceeding on the basis of proper engagement with the state, with Office of the Premier and a response to that, which is why the executive management here took a decision that we can actually go and source private firms, because the losses are considerable and continue to be incurred. So that is the one. The second one is the impact of the differences, Chair, was was, as I indicated, the first finding was you do not have a documented process. And the second finding was you have documented the process, but we still differ in terms of application of that new process, which is use a previous case. And the way we were using the previous case and how AGSA would apply that would be different and lead to now the impact was then we had to revise again and arrive at another, which is what the response was saying, the chair, at another procedure which is currently documented, and so far which is why we then say that the problem is resolved. We're hoping that the goalpost will stay where it is.
Thank you. Thank you very much. Yeah, no, really AGA. You need to be put in one room for a week. And I know you come agree.
With no gloves, Chair.
Sango what you but in a development stage, whole points can be on one place. It must be understood. You can't be on one place. You are changing a particular you are doing transformation.
That's why Chiefs is not winning.
Yeah, no, thank you very much. Are we covered in terms of question 4? Let's deal with question 5 because it is also in question in 2022-2023 only. It's also question. Question 5 on understanding is only in 2023. Is it in both? Yeah, let's deal with it. Question 5. Then from there we'll go to where they are both questions. Honorable Mapolo.
Thank you, Chair and MEC and my colleagues. Question 5 is on understanding of conditional grant. Executive authority in paragraph 10 disclosed in note 45 to financial statement that the department underspent on the conditional grant by 32,376 on the national health insurance. And the first question A says, why did the Department of Health underspend the conditional grant by 32,376? B, who are responsible officials? C, what action did the accounting officer take against the responsible officials? D, what measures did the accounting office put in place to prevent the recurrence of the anomaly? Thank you.
Thank you, Honorable Mapolo. Honorable Emerson.
Thank you.
Thank you very much, Madumi Mawasha. Chair, the underspending of the grant was due to one, delay in the delivery of the MRI machine at Petersburg Hospital to the value of 25.851 million by the service provider, and delay and delivery of invoices for surgical procedures in respect of cataract surgeries, gynecology and urology by 2 contracted service providers to the value of 6 million. Rollover requests of the above mentioned amounts were submitted to Treasury and approved and spent during the 2023-24 financial year. Mr. Philip Kruger, Chief Director, Healthcare Support, is responsible for that area. However, no action could be taken against him or anybody as the delay was due to the failures indicated by people outside of the department. Now, as to measures to prevent recurrence, the department places orders of machinery and equipment on time, and follow-ups are made regarding the delivery. As you see that in Annexure 5.82. However, international market dynamics have direct impact on imported machinery, on the delivery, and that is beyond the control of the department. Thank you, Chair.
Thank you very much. Let me see. Other questions, colleagues? I think it's very clear that there was a rollover and this was spent in the 2023-2024, and we don't have understanding in that financial year. Let's go to question 4, 2023-2024, which is also linked to that year. But there we then bring them. Question 4, significant uncertainties. Honorable Scopa.
Thanks, Chair. Question 4, 2023-2024 financial year. Executive Authority in page 255 of the AG's report. The AG reported that the department is a defendant in multiple lawsuits. The ultimate outcome of these matters cannot presently be determined, and no provision for any liability may result has been made in the financial statements recurring from 2022-2023 financial year. A. Provide a detailed report on the multiple lawsuits in the department per hospital. B. What is the department's plan to strengthen its legal section? C. How far is the department in strengthening the digital system of filing? D. Which measures did the accounting officer put in place to prevent the number of lawsuits? And that will be all, Chair.
Thank you very much, Honorable Scopa. Honorable MEC.
Thank you. I finish with it.
Thank you very much, MEC, Chair and members, colleagues. The Matome Mawasha speaking. Chair, the detailed report per hospital, as at that time, is provided in A, where you can see the biggest contributors. I was addressing the chair, now I'm lost.
There's a chair.
Oh, there's a chair. There's a chair.
Well, go ahead. I'm not sure if he's right, but she asked me to give you a platform. I hope you'll come back while you
Okay, no, that's fine. I just wanted to know what to do. Okay, now the plan to strengthen the legal section. Since we have since strengthened the Legal Service Directorate by appointing a director, a deputy director, and 2 assistant directors in the last 2 years. And these people are admitted attorneys. In the new revised and approved structure that we are in the process of implementing, provision has been made for the unit to move from 11 posts to 15 posts in the Legal Services Unit. The unit consists of litigation, medical, legal, and contract management sub-unit. The minimum requirements for legal officers have been set at LLB, which is at NQF level 8. Now, we've spoken about purely executed mandates by the state attorney, and we've already indicated we will seek to appoint a panel of law firms. We're finalizing the specifications, and we will then proceed to the procurement process. The Director General issued Circular 57 of 2022 regarding a moratorium on the implementation of transversal ICT projects by departments within the Limpopo Provincial Administration. One of those systems is the electronic content management system that would ensure digital filing of submissions, policies, as well as other records, including medical records that are paper-based, that have been scanned. We were anticipating the bid to be concluded in 2025-26 financial year. We still hope that that is the case. The process on our side to acquire a centralized health information system through CETA, we indicated in our earlier discussion that it has not materialized in the 2024 financial year due to delays of 29 months on the part of CETA. It would have ensured that electronic medical records of the patient, which the department will always have access to and are paperless. The department is now exploring a system in the Eastern Cape. Annexure 4C2 explains that. Now, to curb the increases of contingent liabilities, the department has approached the issue on these four these areas, these main focus areas. Chair, this is also similar to what we have read in respect of the previous financial year. I beg not to repeat that. Thank you.
Yeah, thank you very much for the responses. And maybe let me check if there are questions based on the significant uncertainties. But I think a question which was also talking to this section was dealt with in the resolutions. So I'm not sure if there's also another thing that we can ask. Honorable Scopa.
Thanks, Chair. I think there's a tendency in the department of just copying and pasting responses. I'm saying this because of how we dealt with the issues of referring all the matters or waiting advices from Treasury, and the one of not holding anyone accountable. Now with this one of lawsuits, similarly to the one in the 2022-2023 financial report, the response is more or less the same, because now the department resort to training personnel instead of giving us a progress on how efficient is that those trainings that were done, how are they efficient in terms of reducing or preventing the number of lawsuits that the department seems to be dealing with. So I think the department should take the advice that you gave them, Chair, to say that in terms of the work that has been done, there must be a proper progress report that is being reported in this case. And with regards to the digital system that is being explored in the Eastern Cape regarding the electronic medical record for the patients, I wanted to check if the department has checked with other systems. I mean, here in the province we have the Mammo Health and Demographic Surveillance System that I think if we can also check with them, they can assist in terms of how better can the department keep records that are paperless. Maybe they can also provide a solution as to how they can keep that paperless record regarding to the data collection that they're doing there it's there in the UN. If we can just also approach them and see how they can assist you regarding the digital system that you surely need to implement, because that is what is going to assist in terms of managing the lawsuits that are as a result of the department not having a system that can provide evidence as to where are the papers court for John. So that will be my submission. And on with regard to what Honorable, I think he touched on it, Honorable Mabulu, in terms of the capacity. The first thing that the department did also here was to appoint deputy directors, 2 of them, to strengthen the legal system set of the department. I think they need to also fill up all the vacant posts, because it seems like it has effect in terms of how are they being efficient in this regard. That will be my submission, Chair.
Thank you very much, Honorable Scopa. Any other submission? Do you have anything based on what has been submitted? I'm saying, do you have anything to say in terms of the submission? I know that it was not a question, it was just
Chair, we note what the honorable member is saying.
On the system we do.
Yeah, no. We note it, it's noted.
Chair, the Matume Mawash again, we are exploring, as the word was exploring the system in the Eastern Cape. There's no harm in going to look at what is available at UL and other places. And of course, then the procurement rules apply, we will apply those and see where we yeah, thanks.
Of course, UL being our university and having a faculty of medicine, obviously we should work together and have programs that can benefit the department often. So I think that advice is very relevant. If there are no questions on question 4, so we go to question 5, 2023, 2024, question 6, 2022, 2023. They all talk about the achievement of planned targets. And then we go back to Honorable Macheta.
Thanks very much. I'm not sure whether I should check this member of this committee.
Come again?
Should I start with 2020?
2022 is question 6.
Yes.
And then 2023, 2024 is question 5.
Yes. Yeah. So I'll have to start with 2022.
I'm waiting that we
That's fine. Let's start with question 6 on 2022-2023. Achievement on the planned targets. Executing authority in paragraph 31 of the AG's report. The AG reports that key service delivery indicators were not achieved in district health services and provincial hospital services. 6A, why did the department fail to achieve the key service delivery indicators in district health services and provincial service? B, who are the responsible officials? C, what action did the accounting officer put in place to prevent this anomaly? That was 2022-2023. I'm now moving to 2023-2024, question 5. Achievement of planned targets. executing authority from pages 259 to 260 of the AG's report, the AG could not determine if the reported achievements were correct, as adequate supporting evidence was not provided for audit. On district health services and provincial hospital services program, some targets were underachieved, recurring from the 2022-2023 financial year. 5A, what constituted the under and overachievement in these programs? What was the impact of underachievement on service delivery? C, who is the responsible program manager? D, what action did the accounting officer take against the responsible program manager? E, what measures did the accounting officer put in place to prevent the recurrence of the anomaly? I hope I'm done. Thanks very much.
Okay, thank you very much. MC?
Thanks very much, Nchuti.
Thank you very much, Matomi Mawasha. Starting with 2022-23, Chair, there are 6 columns there that indicate the various contributors to the non-achievement of the service delivery indicators. The first column relates to maternal mortality in facility ratio, and I suggest, Chair, that I don't read everything that is there but speak to it. Some women died due to postpartum hemorrhage and HIV, TB infection. Some of those include suicide and herbal intoxication when people were trying to abort babies. Some women died to herbal intoxication when trying to expedite labor. There are also issues of prematurity and death due to some cultural practices, and so on and so forth. Yes. And so on. Now, there's also instances of high loss to follow up amongst these cohorts of ART users and so on and so forth, Chair. Now, when you go to B, we have provided the names of the responsible officials per district responsible for this area of work. I'll beg not to read all of their names, but they are here provided. And then when you move on to C, where it asks what action did the accounting officer put in place to prevent the anomaly. Now, when it comes to maternal mortality rate, perinatal reviews are conducted per hospital and in respect of their feeder PHC facilities. 24-hour maternal death reviews take place. There's been an appointment of family medicine specialist and obstetric and gynecologist, and then implementation of special outreach programs to district offices to empower those that work there. Its strategies saw improvement of this MMR of 80.3 of every 100,000 live births in 2021 to 69.7 of every 100,000 live births. Now, ART, antiretroviral therapy adherence to we monitored the attachment of all new ART clients to treatment support person. We intensified identification of all clients who missed appointments, tracing them through the line list and linking them back to care. Conducting step-up adherence on non-suppressors and monitoring of viral loads very closely. And this strategy saw improvements in the achievements of 2021 to 22 to 22 to 23 financial year, and the figures are indicated there. Accountability meetings were held with the heads of institutions on poorly performing indicators. This has happened in respect of all the heads of the institutions in the department. Increased the budget for vaccines through savings from COE, which also allowed for procurement of buffer stock. Chair, that is the response to that question. Thank you very much. We go to the subsequent year. In respect of that year, which is question 5, what constitute the under and overachievement in these programs? Now, in respect of SEC1 incidents reported within 24 hours, inadequate adherence to the PSI guidelines on the reporting requirements, patient safety incidents guidelines. Chair, if you permit, may I not read the whole table? Then the next one relates to overachievement, and the reasons are provided for overachievement. And permit me not to read the whole one in terms of provincial health services. Maybe I should indicate that the first table was district health services, and then the table next is provincial health services. Again, if you permit, let's not read the whole thing. What was the impact of the underachievement? Chair, the service delivery was not affected as all services were rendered as per the planned programs and available resources. Most underachievement was related to the indicators that are dependent on human behavior, social issues, as well as beliefs, as indicated earlier. Examples are teenage pregnancies, loss to follow-up, malnutrition, early antenatal bookings, immunization, postnatal visits. Now, responsible program managers in respect of the various indicators, they are stated there per district. Allow me not to go through that whole thing in respect of district and provincial services, and that would then conclude that question in respect of the 2 years.
There's still question E, what measures did the accounting officer put?
D. Oh, sorry, Chair, I didn't see. Okay. Now, in instances where substandard performance was deemed to have been provided, consequence management is implemented for responsible officials. It is evidenced in Annexure 5D, Chair.
Yeah, thank you very much. Thank you, MEC. That was question on the achievement of targets. Other questions? Honorable Lembu Boloni.
Thank you, Chairperson. My name is Mentumbulo Ntisi. According to the AG South Africa, on key performance target, especially in program 2, district health services, only 50% were achieved, and at some instance target achieved was 49%, and the budget spent is 99.9%. And in program 4, achieved is 50%, but budget spent is 100%. Actually, I am failing to see the logic on this one, because here is the target. Only 50% was achieved, but the budget 100% was spent. And I just want the clarification there. Although we have just a heated argument with the AG South Africa, I want to hear from the department why. Is because of poor planning? Is because of some of the issues incorporated into the budget, or so on? I just want to know that. And the other one on the ideal hospital initiative, that only 2 of the 30 district hospital, I think 7% was achieved or attended the ideal hospital status. And we have issues like poor stock management practice, according to the AG, medical equipment not available, medical supplies not available, and hygiene facilities not available, cleaning not in accordance with the schedule. In relation with the planned targets and the budget, I want the explanation on in this regard. Thank you.
Thank you very much. Emerson?
Thanks,
Thank you very much, MC. Madome Mawasha. Chair, if you were to look at the very first table A, and you look at the reasons provided in those columns, and I'm going to ask Dr. D to elaborate on this, you will see that it would still be possible to still miss your targets with the expenditure being at that level. Dr. D?
I think to explain the issue of expenditure versus the indicator, if you allow, I can use an example. You'll find that in the HIV space, for example, we have budgeted that we will procure 6 million condoms, and we procure those 6 million condoms, and we distribute 100%. But the indicator to measure whether that preventative action is the impact thereof, we use an indicator called male urethritis syndrome, and it is an STI, and we use it in males only because the biology of the men, they get the UTI generally through sexual transmission, as opposed to the anatomy of a woman where there are other causes. So that tells us that when you look at that indicator, it is not achieved, because while we have procured according to our business plan, and distributed. Unfortunately, at the point of usage, it shows us that we are not getting 100% buy-in.
Don't worry, doctor, it's
Yeah, so that is just an example, and that's why we are saying that a lot of the time, these are behavioral issues. It's the same challenge we encounter when you'll see in the follow-up of patients. They don't come back for their visits. They give us the wrong contact numbers. So when we call them to follow up to say you've missed your appointment, we can't find those people. And even the address, sometimes they give us the wrong address. Chairperson, also to indicate that sometimes you might be aware that we have community health workers who assist us with tracing lost patients in the community. You find that some community members refuse them entry into their yards, saying, you are throwing eyes upon myself. People will now say, I've got 1, 2, 3. So we've had those instances. So you find that that's where we are not able to achieve certain indicators. In the space of maternal health, we are still dealing with a lot of social taboos, if I can call them that, or beliefs, where it is not traditionally acceptable maybe to report your pregnancy early. So you find that the indicator of antenatal booking before 20 weeks is not achieved because of those kind of issues. So we've done surveys, or we are conducting surveys to understand to what degree people are willing to change some of those behavioral concepts, but it's a work in progress. So in the space of children, for example, we are aided by the Child Health Act, the Children's Act, I beg your pardon, which then allows us to invoke the law to protect the child. Whereas with adults, unfortunately, they have agency, so they may do as they please. Thank you.
Thank you very much. You want to make a block?
I know. While I understand the explanation, which is there, but if my memory serves me well, according to the AG, in your budget you also include expenses of the human resources. And that is the reason I got from the AG. But now you are explaining other situations which are very understandable. That if you do that, now you can't achieve, because I had a very critical problem to say that whatever I can do, that I wanted to know as to why we are spending all the money, whereas the target is not achieved. So I advise my friend here to make the target, to achieve the target. he must do as required. Thank you very much, MEC.
Thanks. Yeah, thank you very much. But I have a challenge with the method that you are using to determine the achievement of target. And I understand it very well that you say you look at the end product, the achievement of the aim of that program. Why am I having a problem? Because I think there are cases where, when we talk about service delivery, you cannot be able to measure like that, like you are measuring in case of the example that you are giving. So what are you going to do now? I think we go back to the layman's understanding to say, if I have to do 10 things and I did 5 and I've spent the 10 rand that they've given me, it means I've spent 100%, but performed 50%. Can you assist us? Because not everything could go to that example. Yes, I understand it very well, but I don't just have a quick example that I can give that you cannot be able to have statistics that you can be able to measure. But literally, I've given 10 targets, performed 5, but the whole money was spent. In that case, how do you do it? How do you assess achievement there? MEC.
Okay, thanks, Chair. MEC for help. I think the example that was given actually talks to most of the programs that we have in health, because the same thing will apply when it comes to teenage pregnancy. I can put measures, those family planning and everything. Right now we make sure that we procure those things, they are there. We ensure that our clinics are open for people to access that. Nurses are there to render that service. We go to wherever they are with our health teams to educate them that come and get this service. But at the end of the day, if they do not come, the money already is spent to ensure that thing happens. Others, they come, this month they get an injection or they take pills and they do not come back. So I think with health is different from other departments, because it's more, as they say, about the behavior of a human being or the beliefs and so forth. But what we are saying is that Tina, our responsibility is to ensure that there's access to those things.
Okay. It's noted. Not entirely satisfied, but I can live with it. I can live with the explanation.
It is quite unfortunate. You can't force that horse to drink the water. We understand along those lines. But at the same time, it tells us to say we have a gap elsewhere, especially on the side of men. You see, now, I don't know as to whether one might be correct. Now to try to enforce it and have a special program from young men until us. You know, you must be able to develop that, because I seated here, I can identify where lies the problem. The problem lies with us, men. And from the young a young child or a daughter, my daughter there at home, can't prevent herself to be raped and fall pregnant. Who is doing that? It's a man. Now therefore I think your program must be, I would say, enforceable. I don't know how we're going to do it, Doctor, but we have to enforce something there and make sure that all men are educated from the young generation. That's my take on the matter. We had another guy say, we don't know why.
Honorable Masan.
Thank you, Honorable Chairperson. You'll find that we are very much, concerned about this. Why? Because when we procure those things, let's say medication and the condoms, we procure them being made in it, and then at the end of the day, we lose because those things expire. They do expire.
It's fruitless. Now, indirectly, you are saying there is fruitless. Though you did not achieve the target, so it goes indirectly, fruitless expenditure. But
Yeah.
Yeah. Are you done?
Yeah, I think I'm done.
But I think what Honorable Mabul is raising is the issue of, to close that gap, we need to come up with strategies how to reach the outreach, the campaigns, to educate people, so that we know that we have to make follow-ups. For example, pregnant women must go to clinic as early as possible, and they must finish, because one will just go once and come back to say, hey, my nessa and guy. So such things, there are a lot of things, cultural things, psychological, and so on and so on. So, but I think the department has a responsibility to come up with strategies just to close that particular gap. Because literally when we say 50%, 100, then you see, to an ordinary person may not be able to interpret. Like I'm saying, I'm also having difficulty to accept the explanation to say, yeah, but it means next time when you have this type of situation where you have 50% targets and 100% spending, you must also qualify to it that you must be able to reach, because we've underperformed program 2, then we are proposing 1, 2, 3 to make sure that the targets improves. If there is no any other question, can we pass to question? Is it okay? Or you want to go to the question? It will be question on, let's go to revenue management. Which one? I correct. Question 6, Kamo, and then this side to the question 8, I think. 7. Yes, 7. But it's on revenue, no, it's 8.
Is it 8?
Yeah.
Thank you, Chairperson. Thank you, Chairperson. Question 6, it's on revenue management, 2024, 2023, 2024. Executing authority, page 261 of the AG's report. The AG reported that reasonable steps were not taken to recover debts before writing them off, as required by Treasury Regulation 11.4.1. In page 261 of the AG's report, appropriate processes were not implemented to provide for the identification, collection, and recording of information about revenue as required by Treasury Regulation 7.2.1, which is recurring from the 2022-2023 financial year. The first question, number A, says, why was an amount of 1.193 million written off without following the Treasury regulations? Provide breakdown based. B, why did the accounting officer fail to implement appropriate processes to provide for the identification, collection, and recording of revenue as required by Treasury regulations? C, who are the responsible officials? D, what actions did the accounting officer take against the responsible officials? E, which measures did the accounting officer put in place to curb the recurrence of this anomaly? And then revenue management, question number 8, which is on 2022-2023. The executing authority in paragraph 40 of the AG's report, the AG reports that appropriate processes were not implemented to provide the identification, collection, and recording of revenue as required by the Treasury Regulation 7.2.1. In paragraph 41, the AG was unable to obtain sufficient appropriate audit evidence that effective and appropriate steps were taken to collect all money dues as required by section 38, 1.1c1 of the PFMA. In paragraph 42, the AG reports that all reasonable steps were not taken to recover debts before writing them off as required by Treasury Regulations 11.4.1. In paragraph 43, bad debts are written off contrary to the requirements of the Department of Health write-off policy as required by Treasury Regulation 11.4.2. In paragraph 44, interest was not charged on debts as required by Treasury Regulation 11.5.1, which is recurring matter from 2021-2022 financial year. The question is, which is A, why did the accounting officer fail to implement appropriate processes to provide for the identification, collection, and recording of revenue as required by Treasury Regulation 7.2.1. B, why were effective and appropriate steps not taken to collect all money due as required by section 38, 1C1 of the PFMA? C, why did accounting officer fail to ensure that reasonable steps were taken to recover debts before writing them off as required by Treasury Regulation 11.4.1? D, why did the accounting officer write off bad debts contrary to the requirement of the department's write-off policy as required by Treasury Regulation 11.4.2? E, why did the accounting officer fail to charge interest on debts as required by Treasury Regulation 11.5.1? F, what are the responsible officials? What actions did the executing authority take against the accounting officer, which is G? H, what action did the accounting officer take against the chief financial officer and responsible officials? I, what measures did the accounting officer put in place to correct this anomaly? Thank you, Chairperson.
Thank you, Honorable. MEC.
Thank you, Acting HOD.
Thank you very much, Mutumi Mawasha. Let's start with the revenue management in respect of the year 2022-23, question 8. The response is that public perception that health services are free result in non-payment of patient fees. That is exacerbated by the increased unemployment rate, which makes it difficult for the public to settle their medical costs. And patients who visited the hospital when they are still working and now are not working can no longer afford to pay for their services. And whilst public health facilities cannot turn away patients on the account of not having money to pay or having outstanding debts, because this is a basic human right in terms of the Constitution. That is why the increase in the debt book and the impairment of the account. There are also budgetary constraints to resource collecting institutions with the relevant human capacity and other resources to effectively make these collections. The department has implemented, documented appropriate processes to provide for identification, collection, and recording of revenue, resulting in the improved audit outcome since 2018-19 to date on accrued departmental revenue as compared to the other years before this. In the subsequent year, the department managed to collect and surpass its 2023-24 revenue estimates of 210 million by 11 million to 221 million. This is also 22 million or 11% above the 22-23 actual collection of 199 million. So there's been quite significant improvement here. The debt write-offs has decreased from yearly averages of 290 million in the prior years to an average of 105 million in the recent 2 years. This showed 64% decrease in the previous year's write-offs. Now, as to steps not taken to collect all money due, the challenges are as follows. Again, public perceptions on free health services, unemployment rate, the human rights factor, delays in the responses by the Government Employee Pension Fund on the progress of disbursements of benefits, inadequate follow-ups made and late billing or identification of liabilities by some of our relevant officials. The accounting officer has taken effective and appropriate steps to collect money due to the department, resulting in gradual improvement of revenue collection at an average of 11% per year. Chair, the debt write-off have decreased, improved channel of communication between the department and the main debtors. Now, as to why the accounting officer failed to ensure reasonable steps were taken to recover debts before writing them off, the accounting officer has ensured that write-offs are done in line with the developed guidelines as required by the Treasury Regulation 11.4.2. Although all the steps were followed in terms of the departmental procedure, it was viewed as inadequate by the auditors. The process followed, therefore, is as follows. Patient fees was done in line with Section 11 and 12 of the Prescription Act 68 of 1969, Section 23 of the Road Accident Fund 56 of 1996, Medical Schemes Act 131 of 1998, Provincial Transversal Revenue Policy, and paragraph 10 of the Departmental Patient Fees Debt Management Procedure Manual. Amounts that are 100 rand and less were considered to write off as uneconomic to chase them. The write-off was also part of the departmental strategy to clean up old irrecoverable amounts that were not paid. The accounting officer has therefore disclosed such write-off amounts in the AFS as required by Section 11.4.3 of the Treasury Regulation and Section E316 of the Provincial Transversal Policy. The accounting officer wrote off bad debts contrary to the requirements of the department's write-off policy due to challenges listed below, and these are the challenges I've read earlier, Chair. Permit me not to repeat. The provided evidence of follow-ups made as a requirement in terms of paragraph 8 of the Departmental Patient Fees Procedure Manual was deemed to be inadequate by auditors. However, the department used paragraph 10.1A of the same procedure manual. It is no longer certain, probable, and open codes, by the way, that the economic benefits or service potential associated with the transaction will flow to the department. Paragraph 10.1M, which also states open codes, the debt/group of debt as prescribed in terms of the Prescription Act 68 of 1969 as amended. Further, due to the volume of debtors, 1,786 million transactions in the book, the department could not provide follow-up for each patient. Excuse me. But general follow-ups, documents like meeting minutes, attendance registers, reminding patients when they visit, letters to send to debtors, etc. This was also deemed to be inadequate and non-compliant to our policy. The cost involved in tracing and follow-up of individual patients, considering the volume of debtors, compromise aggressive recovery process and proof thereof. The write-off of patient fees was therefore done as indicated in 8C2 above. The accounting officer has furthermore disclosed such write-off amounts in the AFS as required in terms of section 11.4.3 of Treasury regulations and item E316 of the transversal policy. Why did the accounting officer fail to charge interest? The accounting officer could not charge interest to patient fees as that was going to be contrary to applicable government directives. The main reason for not charging interest are as follows. Government Gazette number 46688 in its totality which repealed government number 469 of 23 June 2017 and the one 499 of 18 May 2018, which was repealed in its totality. All accumulated balances relating to patients' fees, all categories are therefore exempted from paying interest as per this gazette. In 2020-21 financial year audit, the department calculated the interest as indicated in Annexure 8E2, but after consultation with National Treasury and National AGSA, the department was directed to adjust this by removing it in the AFS reported figures. This was done in all provinces in the health department. In terms of the regulation 11.5.1 of the Treasury, interest must be charged on debt to the state at the interest rate determined by the Minister of Finance in terms of Section 80 of the Act. This is the section that was repealed per government as gazette indicated above. The department, like all other provinces, is therefore currently not charging interest to all balances. All other debts that are required to charge interest in terms of the government were charged interest accordingly. Now, the chair, a table of the officials responsible for this space in the various hospitals where this occurred, and the boss is the Director Revenue Management indicated there. Now, no actions were taken by the executive authority against the accounting officer because the accounting officer has implemented improvement plans and recommendations of the audit, resulting in the three of the above five mentioned items resolved. So the accounting officer has made strides and achieved something. The accounting officer ensured that actions are taken by the CFO against the relevant officials Non-payment of fees by the public is beyond the control of the accounting officer. The accounting officer has not contravened the regulations in relation to the charging of interest. Now, further, the accounting officer has not taken action against the CFO because the CFO has implemented an improved plan that resulted in the 3 of the 5 audit findings resolved and the remaining 2 identified as immaterial. The CFO has taken corrective action against responsible officials who directly or indirectly contributed to the audit findings. Non-payment of fees by the public, again, is beyond our control. And Chair, if we move on to I, because the next paragraph is repeated. Now, measures taken to correct the anomaly. The audit action plan is developed and being implemented, and it outlines the following: training of the identified officials and various responsibilities of revenue and debt management, development and implementation of the relevant guidelines, monitoring and enforcement of compliance, implementation of consequence management, recovery of long outstanding debts, strengthening public awareness in health services, and to this effect a plan is being finalized to launch a vigorous communication campaign to change the public perception on this and many other things. Debt management procedure manuals are being reviewed. Case managers have been appointed in regional and tertiary hospitals to ensure complete and correct billing. Spot billing approach. Billing on the spot is introduced and monitored. Channels of communication between the department and the main debtors, road accident fund, medical aid schemes, and government departments are improved. The departments is to ensure continuous engagement and participation in the structures. So no action is required to charge interest for health services, as this category of debtors are exempted as per the Government Gazette referred to earlier, Chair. In respect of 23-24, here the amount is 1.193 million written off. The amount was written off, Chair, as irrecoverable because of the 144 deceased officials in respect of whom it occurred, that is between 2015 and 2022. The write-off was due to employee benefits like leave gratuity that were disbursed to the beneficiaries without any deduction of liabilities by GEPF. Debt handled over to debt collectors could not be recovered due to lack of traceable beneficiaries. Now, accounts prescribed within GEPF. Now, in terms of Section 29 of the Administration of Estates Act 66 of 1996, it says all persons having claims against the deceased estate are to lodge such claims with the executor within such period, not being less than 30 days or more than 3 months from the date of the latest publication of the notice as may be prescribed therein. This is the notice announcing the passing of the person and an estate. If any person fails to lodge his claim against any deceased estate before the expiry of the period prescribed in respect of the estate, such person is not entitled in respect of his claim to demand restitution from any other claimant of any monies paid to such other claimant and any time or before he lodged his claim. So if you fail to claim against the estate, you are out. So the delay by GEPF to provide feedback on liability claim from the deceased benefit result in the department being unable to pursue the process of claims against estate. So the debts were then written off in line with the departmental debt procedure manual. The debts were written off from the debt book. However, 14 of these debts to the value of 506,423.33 are still being pursued through the debt collectors. Should this process succeed, the recovered debts will be recorded as bad debts recovered in terms of the applicable standards, and here they are indicated per district, number of the transactions per that such district, coming to that total amount of 1.9, or you can say 2. Why did the officer fail to implement, the accounting officer fail to implement appropriate process to provide for identification and collection and recording of revenue as prescribed by the regulation? This finding relates to patients referred to private facilities contracted by the department that had not been billed at year end. The accounting officer has since documented processes for the identification, collection as required in terms of Regulation 7.2. The failure by the accounting officer to fully implement this was as a result of inadequate guidelines to deal with patients provided with health services at private institutions, which resulted in delay in identification, classification, recording, and billing of such patients accordingly in line with patient debt procedure. The patients were subsequently identified, recorded, and billed accordingly. At C, the officials involved are all the managers at district level. Allow me not to read their names. What actions did the accounting officer take against the official? There's Annexure 6D that shows consequence management that has been implemented. Which measures did the accounting officer put in place to curb recurrence? We have developed a procedure manual to guide billing of patients referred to by private facilities contracted by the department. Relating to staff debts, the department is reviewing the process of debt recovery before employee benefits are paid out. Chair, that deals with revenue collection in respect of these 2 years. Thank you.
Yeah, thank you very much. The concern is, which has been observed throughout, is that in many of the accounts, the department and the AG don't see things the same. In 2022-2023, you wrote off debts, and unfortunately the assessment was not sufficient by the AG was not convinced that you've done all what was supposed to be done to write off. And also in the 2023-2024, the same matter is still raised, that it was viewed as inadequate for the auditor. This is a concern, and it's I don't know, maybe the AG and the department, like I said, maybe at one stage we need to put you together so that you understand why do you always differ. I think the processes are very clear, the guidelines are clear, but the misinterpretation is always different. Why is that happening? That is a concern that we are raising as the community. The other issue, especially on this is 2020, where you are saying there's a perception that the public take hospital services as free. Are there efforts to educate the public as who must pay, who must not pay? Because indeed, we know that a young up to 7 and older people are not paying, but there is also a scenario that if maybe an older person can go to a private doctor, and that doctor said go to the hospital, for example, when he or she arrives there with a letter from the doctor, they say no, as much as you are qualifying not to pay, but because you studied at the private doctor, it means that you can be able to pay, so you must pay. So such issues, how do you deal with them? That's what I wanted to. Are there any other acting chairs dedicated to pick up something that can assist or help you? The actor currently. Okay, the acting chair is covered. Was Malia any question?
Yeah, Chairperson, you know the accounting officer within your standing operating procedures, you have got to make sure that the effective and efficient process is in place. You want to deal with debt, when debt is being given, and that you need to act. And I know that there's HUDs that have changed since that day or since those things have taken place. But if the standard, if the SOPs of Treasury and government is not being implemented, people must be held accountable. I hear on the one side that you are trying to get the debt. But my question will be simply put. Was the policies implemented to its letter? And if it was not, the people that oversaw that process, because obviously they're on the value chain, must then be held accountable. And that's why I believe the AG and you might not be on the same page. And if they were not standing operating procedures, then I would look at the 3 people on my left here and say it was the responsibility of the 3 people on the left to make sure that those standing operating procedures were then well communicated, were established, became a policy. And therefore, the accountability part in making sure that that is being done must then be adhered. I know that I can't get the money maybe from you, but then there is a portion of liability, and I can argue that. And the issue around stock debt is, for me, is the concerning part. I understand the difficulties with people coming to hospital. That portion I don't want to venture into that. I think we've made strides, and there's a lot of good things moving into that direction. But maybe I can get on the first portion.
Honorable Marcel.
Thank you very much, Mr. President. Maybe I don't understand these things, but or maybe since I went out, maybe somebody asked a question. I just wanted to know, because I'm the one who asked about this revenue management on 2022-2023 and then 2023-2024. But to my surprise, I can see that the department didn't respond on financial year 2023-2024. So maybe they will give us a reason why, or maybe things are the same, I don't
I'm not sure, I think they responded to all the 2 financial years. Yes, they did. Maybe the specific question, maybe you can still ask the question, they will respond to it. Honorable Master.
I don't know the question. It's like maybe I'm mixed, but I think they didn't respond to 2023-2024.
Can we assist, Honorable? They started with 2023, 2024. I was out myself when I came back. It was concluding on 2022, 2023 and going to 2022, 2024.
Maybe it's
No, I was giving opportunity to say if you have a question, you can still ask because according to the presentation, the 2022-2023 was focusing on revenue management, in particular to get the funds that from the people who are not paying the hospitals and all those things. And with the 2023-2024, there is an issue raised by GEPF. So they're not living the same issues in both years.
Maybe let's check page 51 and page 67. Maybe let's check that.
51 of which year?
Page 51 and page 67.
Okay. 51 of 2022, 2023.
2023, 2024.
All right.
And 67.
We are in your hands, Honorable Matata Masa.
Yeah, checking 51.
Maybe let's give.
Maybe I'm just mixing things, but yeah.
No problem.
Yeah, no, we will maybe let them respond as you are reorienting yourself. Honorable Mrs.
Executive
Yeah, thank you. Thank you very much, Matume Mawasha. There are two questions or 2 comments made. Let me speak to the area of standard operating procedures. I think if you go back to the report as presented, you will find there are measures in place, procedures, guidelines, and all of that in place. Honorable Smale, the reality is that there will always be the human factor. There will always be an individual somewhere who does not do that which they're supposed to do. Which is why, again, when you go back to the report, you will find there's been consequence management implemented. It is one of the annexures to the report. And it is implemented at the level where it would be unfair when you see let me give you an example. When you see the efforts that the CFO is making, the efforts that a chief director is making, and somebody else down the value chain doesn't do what they're supposed to do, it is only fair to take action against that individual, not the one that you can observe is making an effort. So yeah. So then that is why you will see that action is taken by the CFO against certain individuals. Because this happens in the midst of all efforts to ensure that things are proper. So there's always going to be people who wake up and come to work not to do work, etc., etc. The first one was
It was the differences.
the differences for yes.
Thank you. My name is Justice Mugao. The first question, which was talking about the differences between us and the AG, I would like to indicate that we do not have differences. And what I would like to indicate, which is something that we need to appreciate, is that when AG audit, they also look at certain level of execution that the department should have achieved. Given example, we went to an extent when we look at the staff debt, when they exit the system, you find that the issue of the root form that give an employee who is supposed to exit the system has been signed across and allow that person to exit. But immediately after a month, when the person has exited, a debt was identified at a certain corner, whereby obviously there should be consequence management for that. So when you follow that particular debt at GEPF, you find that you are not getting that cooperation that you expect to get from GPF in order for you to recoup the money to close that particular debt that you have identified. As a result of that, obviously AG will not agree with us. We'll say, no, though you did follow up and you went to an extent of going to GPF, you should have closed it while it was still in your institution. So failure to close it while it was still in the Department of Health, to them it's a non-compliance, and we agree. That is why when we look at our action plan, we indicated very clear that we are now reviewing our SOP, making sure that we should plug those gaps in order to make sure that going forward, no one must exist the system and identification of that could happen after. Hence, even when you look at the responsible officials, you saw directors, human resources. They were identified as a result of that particular issue that was identified, which we agreed with the AG. And from the side of the department, we were trying to indicate to say, if you say we didn't comply, whereas we tried our all-level best to even chase up to the GPF. After the GPF, we chased also the beneficiaries. Unfortunately, we couldn't get the money. We thought we have done what we could have done, but they said no. Put the system that will prevent that to happen, so that you should get your money before the person exits. That is why the issue of difference is not there. We agree to say it's just a matter of us upping the game that we have acted. So when it comes to the issue of patient deaths, patient death, honestly speaking, is quite big. We also participated in a contract that has been concluded by our National Treasury. Unfortunately, even when we've got those service providers in our midst, they are failing to make any significant recovery. It's still less than 2%, which is nothing compared to the debt book. The debt book is sitting now at almost a billion. So you could see that those that we are servicing and giving services on credit are people who do not have money, because even though you have given or handed them to the debt collectors who specialize on that, they are failing to get something out of them. And that on itself is also going to be a non-compliant when it comes to the EG side. Because of one reason, you find that I was talking to the GITO, while we were sitting this morning, so maybe we should go to an extent of having to send SMSs and all those stuff. That we appreciate the fact that some of our people, they do not even have the cell phone, they are not accessible. But if we can access even that 50% and 60%, we could go to an extent of trying to convince AG to say, we have done our best in trying to comply with this element of doing our best in collecting prior to write-off. So far, we are doing our best in trying to plug those gaps. We believe that going forward, that non-compliance will be, resolved. So when we talk about the education, Looking at, our geographical, situation, we work together with the traditional leaders, and we go to an extent of making sure that they are aware that we are servicing their people and they must get this education that they need to pay for the services. We have also introduced what we call spot billing, which was not there before, whereby before you leave our institution, you have been given the bill and you have been negotiated with to a point that even if you pay any percent of the amount that we have, it will be appreciated. Because we are going back to that issue that we spoke about to say, this, notion of saying public, health services for free. We are trying by all means, even at our institution, to make sure that those that we are servicing, they appreciate that without paying something towards it, it will not assist, the department. However, it has started to show some, good results. Since we have started the spot billing, the billing, and the debt book has exponentially increased. And also the issue of the revenue collection in terms of percentages, improved a bit. But the issue is that we are still doing that on a daily basis. In the morning, leadership at the hospital, they're expected to preach the message at, areas like casualty, at the areas like, OPD, in order to make sure that those people, appreciate that the services that they are receiving, at least something must be done because it's also discounted. On the issue of the SOP, that should include measures on how to deal with the debt, and we do have the SOP, and the SOP is very much explicit, and the SOP, we are implementing it, but we appreciate that, we have to review that and also bring in this other additional element that we need to make sure that, this matter of non-compliance is resolved in order for us to get a clean audit going forward. Staff debt, I think it was just a concern from Honorable Smale, and we agree with you to say, when you look at the staff debt, we have done everything in our power. We also went to an extent of involving the third party, collectors, but we realized that they are not winning. We also escalated this to Treasury, the PAG's office, to request assistance to say, shouldn't we look at any other alternative way whereby we could get, effective and efficient service providers who can assist us in collecting this money due? Because it doesn't make sense that the collectors that we have, they are even failing to follow. Individual like, professionals that got the bursaries but decided to leave the province, they're in other areas in private sector whatsoever. Those are the people that to us is like a low-hanging fruit. But we're still failing to get money from them. Now we also have, our service providers in our midst. So we had to escalate it back to Treasury because they've been appointed by Treasury, but we wanted to make sure that if they could tighten their specification in order to get the best in the market, who can assist us in this regard. Thank you.
Thank you very much. On the issue of differences, maybe it's because of the way, and we raised it earlier, the way you are reporting. You don't report fully to indicate that after the view of the auditor as inadequate, you then had to do 1, 2, 3 to comply with that. That was going to close the whole statement. But for you to leave the statement as auditor viewed this as inadequate, a person can assume that it was a difference and you did not do anything after that particular issue that was raised by the AG. We know that the AG will always raise issues, and it is his or her duty to raise issues, but the purpose is for you to comply. So after an issue is raised, it means you must do something, like you are indicating. If that thing is not indicated in the report, that after that issue was raised, then this happened, it will be taken as maybe it was left at that particular level. So your reporting must be detailed, must come to a conclusion, so that anybody who goes through the report will indicate, oh, after this, then there was an agreement, or there was an implementation of the recommendation by the AG. I mean, yes, the recommendation by the AG. But the last thing is that on the accountability. Acting HOD, you know, accountability will always look at the accounting officer. It doesn't matter who has done a mess. But we are saying, if there was no consequence management at a particular level, you take responsibility. So what must happen is that you must make sure that at all levels there is that commitment of accountability. The employee, the immediate supervisor, the director, if the director does not take action against the supervisor who did not take action against the worker, then it is that thing so so if at one stage but I take action, then Molo must take responsibility for Bata, because Bata did not take any action, and then when Molo, you also did not take any action against Bata. Yeah, this thing is very difficult. You cannot interpret it. We will not know how to interpret it. But it is a chain. But if everybody fails, the last person is the accounting officer. So we say, MEC, why didn't you take action against the accounting officer? And if we are convinced that the MEC did not take action herself, we'll also say, Premier, you must take action against the MEC, because the MEC fails to take the action against the HOD. HOD fails to take action against the director of logistics, just like that until at least somebody adjusts responsibility. So we must understand along those lines. We are not saying, as if we say the MEC must take action against the HOD, we are not saying the HOD is not doing anything. We are saying is the accounting officer and must take make sure that at all levels there is an implementation of consequence management. Yes. What does that mean? You go there because of relay mistake, and you have to be there yourself. You have to take responsibility. So, but I think that we've done justice to the revenue management. So let's go to the last question, which is question number 7, both section.
Thank you, Chairperson. My name is Nempumboro Nitisi. Question 7. On the year ended 31st March 2023, page 48. Annual financial and annual report. Executing authority in paragraph 38 of the AG's report, AG reports that the financial statements submitted for auditing were not prepared in accordance with the prescribed financial reporting framework and supported by full and proper records as required by section 41A and B of the PFMA, recurring matter from 2021-2022 financial statements. Question A. Why did the accounting officer submit the financial statements that were not prepared in accordance with the prescribed financial reporting framework as required by section 41A and B of the PFMA? B. What action did the executing authority take against the accounting officer? C. What action did the accounting officer take against the chief financial officer and the senior managers. D, what measures did the accounting officer put in place to prevent the recurrence of this anomaly? And then going to the financial year 2023-2024 in page 70, annual financial and annual report. Executing authority on page 261 of the AG's report. The AG noted that the department did not determine if any state institution involved in education and training required computer equipment before disposal of such equipment as required by Treasury Regulation 16A,7,7. On page 261 of the AGC report, proper control systems were not in place at the department to ensure the safeguarding and the maintenance of assets as required by section 38(1)(d) of the PFMA. The carrying matter from 2021-2023 financial year. Question A, why did the accounting officer not determine if any state institution involved in education and or training required computer equipment before disposal of such equipment as required by Treasury Regulation number 16A7,7. B, how many clinics and vehicles are still in good condition? Provide data per district. C, why did the accounting officer not put systems in place to safeguard and maintain assets as required by section 38(1) of the PFMA? D, who are the responsible officials? E, what action did the accounting officer take against the responsible officials? F, number last, which measures did the accounting officer put in place to correct this anomaly? Thank you, Chairperson.
Thank you, Honorable Mloni. Honorable MEC.
Thank you, Excellent Chair.
Thank you very much, MEC Chair and members and my colleagues. In respect of 2022-23, question 7, Chair, the preparation of the financial statement in that year was as a result of the same matter we spoke to, which was the matter around contingent liability that we have already outlined. So allow me not to repeat that. And again, as indicated, no action was taken against the accounting officer for reasons that were stated earlier. However, perhaps here one must indicate that the finding raised in 2022-23 was a new finding that had to be raised, that had not been raised in the previous years. I think we've also kind of touched base on this. The assessment of contingent liabilities was left to the department to determine the methodology, as there's no standard assessment methodology across the country. The head of portfolio engaged the MEC and accounting officer to recommend a way forward on the assessment of contingent liabilities as evidenced in Annexure 7B. No action was taken against the CFO. The department engaged AXA to address the issue of the methodology. Again, Chair, we have responded to this to say this is why at the present time we anticipate that there should not be any further issues. Now, on to 23-24, Chair, as it pertains to, again, the annual financial and statements and the annual report. There's the matter of disposal of equipment. The department failed to determine if any state institution involved in education or training required computer equipment before disposal due to the condition of the department's computer equipment that were disposed for the year 2022-23 and 2023-24. Now, the department did not approach any state institution as all computer equipment disposed were assessed by IT, the department's technicians, and the condition were identified as poor, obsolete, and scrap, that they were not repairable. The department's interpretation was that the educational institutions may only be approached in the instance where the computer equipment being disposed is of a good condition so that it may be used in educational institutions. Now, this was not the case. Now as it relates to vehicles, to clinics and vehicles that are in good condition, there's a table there provided. Clinics in good condition, in each district: Capricorn 96, Mopani 98, Sekhukhune 85, Vembe 121, Waterberg 59, totaling 426, and the vehicles per district totaling 1,453, broken down like that. Now, what did the accounting officer, why did the accounting officer not put system in place to safeguard assets? Now, when it relates to movable assets, investigations of assets that were disposed as under investigation were finalized end of November 2024. The assets that could not be located after the investigation were submitted for further investigation by the Risk Management Unit and for determination. The investigations are still in progress and will be finalized by end of February. As at the time of preparing the report, in respect of maintenance of movable assets, the department is advertising and procuring assets with maintenance plans, especially with regards to medical equipment. Now, as it relates to immovable assets, the department introduced a panel of contractors and hardwares. I've spoken to this. I've also spoken to district maintenance teams. Now, the responsible officials are listed there, Mudau L, and the list is pretty long. I'm looking for Mawasha. There's none. Now, action taken against responsible officials. The department was in the process of migrating from the board to Logis from May 2023 to 11 December 2024 as part of the Treasury Project Plan. Now, as part of this plan, big departments such as ours were required to prepare from May 2023 and commence with migration from September 2023. According to the Movable Asset Transversal Policy, physical verification is required to be conducted at least once per annum. In 2023-24 financial year, all departments were expected to, by provincial treasury, to conduct a verification on board as board was decommissioned. The physical verification was conducted manually. The process of manual verification was running parallel with the migration to Logis. I think it should be, were exempted by provincial treasury from conducting verification on board because it was decommissioned. I don't think I had read that properly. Now, the process of manual verifications was running parallel with the migration to Logis. The verification of 293,880 was conducted manually from October 2023 to 31st March 2024. The parallel process delayed the finalization of verification, which resulted in assets that had not been verified by the 31st of March 2024 being disclosed as under investigation. The department conducted investigation of 20,922 assets that had not been verified and finalized the investigation in November 2024. Therefore, the accounting officer did not take action against officials due to the above. Measures implemented are as follows. Investigations of assets that were disclosed as under investigation were conducted from October 2024 to 15 November 2024. The department fast-tracked the migration to Logis and has submitted all stores to National Treasury for loading to enable the department to conduct a physical verification on the Logis system. The last cleanup tool was submitted on 11 December 2024. It is anticipated that the migration will be finalized by the National Treasury by the end of January 2025 at the time of putting together the report, and the physical verification on Logis will commence immediately upon finalization of loading the assets. The department will follow up with Treasury, who is the point of contact for migration on a weekly basis until the finalization of the loading by the National Treasury. Conducting a physical verification through the system scanners is efficient and allows for sufficient time to investigate any assets that may not have been verified prior to financial statements. Thank you, Chair. That concludes the response.
Thank you very much. On 2023-2024, on the disposal of assets, I think Treasury, this policy on disposal must be reviewed, because all the departments, when they talk of disposing, they say the education training institutions, and like you indicated that you did not dispose that in that way because you realize that those are no longer used. But in some cases, other departments will just say, because we don't want a query from anybody. Here is a school, and we take 25 computers to that school. And that school will start with those computers that are not used. And they themselves also have a challenge in terms of disposing them. Because when you have to dispose them, the Department of Education will say, their education is worse because you have to write 50 letters until you are authorized. So you have to write to the secretary, to the district. So the steps are so I think if you dump at training institution, you are not assisting, especially if they are not in the conditions that can be usable. You are creating a problem for that institution because they also have to follow a policy in terms of disposing that, which is a problem for that. But the other thing on B is the issue of vehicles. I'm not sure how you allocate resources to this district, but I can see Bembe with 121 clinics and saving only 286 vehicles. But we have Capricorn and Mopani who have 18 and 318 and 320 respectively. Is there any maybe model that you are used, or are you using the geographic, the vastness of the area? And I know in this case the district which is very vast is Waterbank, where you have Northern, you have got Tawazini, you have got Villa, you have got and that one next to Varapat and next to what is that? The last in the border there. What game is Pinas Refi? Yeah, Pinas Refi. So we talk of Pinas Refi and the Palale and Northern and Tarazini. So at first I was thinking that maybe we look at the vastness of the area, but I realized maybe the criteria is different. So this are there any other questions? Honorable Nyampumpulo?
Yes, thank you, Chairperson. My name is Nyampumpulo TC. I just want to raise a concern here. You see, to submit a financial statement, not in accordance with the prescription, I think in financial conduct and those who are in this sector, that's the first thing one must know. And I think it's just a criminal offense, that one. Because how on earth, you see, you can make a mistake somewhere, somehow, but you can't submit a financial statement not in accordance with the prescription of the pieces of the legislation. It's very basic. And the upper and psychotamba nansana come up on consequence management. You see, that relates to say that senior management, they are untouchable, only the junior officials. From the different departments, actions were taken, MAC, against the HOD. Some of the HOD resigned because actions were taken against them. But here, if you are the HOD, you are untouchable. If you are the CFO, you are untouchable. I want to give reasons. If a junior official make a mistake, there is only alpha and omega in that department when it comes to finance. CFO, boom down. And when he is unable to do that, that is the HOD. We cannot go and persecute a junior official who does not have the expertise and even the visionary of the department, how the department is being run. Throughout this report, no action was taken against the accounting officer. No action taken against the chief financial officer. You see, if you look at the report of the AG, in 2021, there was a movable, tangible assets. The problem on that, 2022, movable, tangible assets, again, it's repeating. When we have one CFO, tangible contingent liabilities, in 2022-2023, against contingent liabilities. And we are sitting here, there is no action taken against any other thing. These things are repeating, and you got the qualified during these years. And throughout here, no action is taken. No action is taken. And as if maybe everything is 100%. MAC is now time to look at your senior managers so that this department maintain unqualified audit and provide effective service to the poor people of Limpopo. You see, we cannot, things are repeating. Now we are talking about the financial statement, Vanna. Financial statement. ini ikugodiwa hangi na ka EMS pass yangi, but we have the last person at the department submitting financial statement not in accordance with the law. Is totally unacceptable. Straight for me, we cannot come here and clarify. I know the CFO can clarify all the facts and so on, but he can't clarify the man. But I have to congratulate the department for having unqualified. Maybe it's the reason why they are not taking action against the CFO and the HOD, although it's acting, one today acting, one the other 6 months acting, and the other one, which is not good for the provincial government of Limpopo. Things have changed to this change. So let's change and have an appointed HOD, so that we will take action against him or her if things are not going in a proper way. Thank you very much.
Yeah.
No.
Thank you. Yeah, I think that one does not need clarity. Does affect that there is no consequence management in the department. There is no consequence management where the department is claiming that they've taken consequence management. There is no proof. So when we withdraw our contribution, we say there's no consequence management, and there's no, as long as there's no consequence management, and as long as there is the position of the HOD MEC is not felt, there will not be stability. We know when you are acting, you don't have, even though the law gives you the absolute or all the authority, but as an individual, you know, and even some of your subordinates will always remind you that, hey, you must remember that you are acting. The next time you'll be with us on this side. Maybe if it's a DDG, but don't forget, next time you'll be with us as the DDG. So that person is vulnerable in the first place. So there's certain decisions that he or she may not fully implement or be comfortable in. And Rena Scopa will say, MEC, charge accounting office, charge the acting. So this issue of instability within the department, if we don't prioritize filling especially the higher posts, we are creating a problem. Because that unqualified for 2022-2023, something like it, because as with these challenges, we may regress. So we need to work very hard as a team health to ensure that indeed we must maintain not only the unqualified audit, we want clean audit, because we know that you are capable to do that. So, like I was saying, we don't have to respond on the issue, consequence management, and for the fact that just take it as an observation. We don't, let's just take it as an observation. We may not conclude on it, but we may not defend ourselves. Yeah, we may not defend on ourselves, because indeed there was no way in anything where the CEO was charged. There was no a single case where the acting HOD was charged. I don't remember seeing that. But generally, even with others, the charging or the consequence is very minimal. It's very minimal. So we know what you said. We can't just be in the charging spree acting HOD. But when action needs to be taken, we must take action so that they know. Because if you don't take action, you are cautious that we will demoralize the workforce. They are also looking, oh, this thing you can do, and then nobody's saying anything. It will continue. So we'll continue to have the qualified and the qualified audits without going to the clean audit, because they know that there's no action that can be taken, especially on compliance. You know, I said this morning that non-compliance is deliberate. When somebody is not complying with the legislation, he's doing that deliberate. And we can also equate it to fraud and corruption, because you are doing it for a particular purpose. It's not just innocent. So such things, we must just note that indeed they may compromise the stability within the department. Yeah, there are issues that were raised if you, without defending.
Thanks very much, Acting HOD, without defending. Yes.
Mantome Mawasha, once more. Let me say, I was actually under the impression that the chair was making close on the vote, because already the matter of consequence management, it's discussed. We have several annexures to the reports in both years that show action in terms of doing business with the state, asset management, and so on and so forth. But the committee is of the view that it's not adequate. We'll take note of that and engage on the subject ourselves in the department. I must also just state, Chair, that previously the Scopa has been saying you're just issuing warnings left, right, and center. But if you look at the report, you will see that we've gone into hearings and there's been guilt findings and salaries have been taken and so on and so forth, beyond just letters. So we listened. We listened. So we will continue to discuss the matter in the executive management. I think, Chair, that was the one matter that I'm hearing in conclusion.
And there will be no alpha and omega in the department. There shall be no alpha and omega.
So if we no longer have questions, yes, now, HOD, we are saying, yes, there are consequence management visible, but we are saying based on the issues that have been raised in the report, we feel that it is not enough. There are in many cases where you're supposed to take action and you do not take action. And the observation that indeed most of the actions were taken to middle management or ordinary workers, its effect is visible in here. So we are saying those who are responsible must take responsibility. If they are not doing so, action must be taken against them. And we are also not saying we must be in the charging spree. Where it is due, must make sure that that happens. If it is not necessary to charge, it's not necessary as well. So we believe that section number, all questions were covered. We're making follow-up questions and clarifications. And as we were deliberating, we were also making recommendations, which will later turn into resolutions. But we believe that as and when we were debating and giving some recommendation or advices, we were noting, even before the House can adopt the resolutions, you know that there are areas that we raise that you must start to correct. So without any waste of time, we will go to the comment, item number 7, which is the comment by the
Thank you very much, Honorable Chair. My name is Klaas Mhlongo. I don't have much comment from my side, Honorable Chair, but to appreciate the invite to come through to make a representation and to basically empower this committee in terms of the insights that we've obtained, the audit outcomes, so that the committee will be able to exercise its oversight responsibilities. So that's my closing, my comment, Chair, on behalf of the Office of the AG. Thank you.
Provincial Accountant General. Chair, thanks once more. You can note the department over-relies on treasury, as it was discussed, to say everything is in consultation with provincial treasury, but we will continue to support our department's chairperson, and we are working together to make sure that the department also improve and go to the clean audit. We will really appreciate that as a province for a Department of Health to attain a clean audit. Thanks, Chair, and thanks to the members and the discussions. We have noted all the comments from the members. We will also relay the information to the head of department and the MEC for Provincial Treasury on issues that members raised in the morning during the briefing. Thank you.
Thank you very much, Provincial Treasury.
Thanks very much, Honorable Chair. We just want to appreciate this sitting and also say that we have noted all the comments and all the concerns, and as the department will continue to work hard to ensure that we improve, and when we improve, we even improve our audit outcome to clean audit. So we appreciate that, and we'll continue working together with the committee to ensure that the department gets better and better every day. Thank you very much.
Thank you very much. On the way forward, as we were discussing, I think we were having a way forward to say Scopa will have quarterly meetings where we'll request the department to give the progress report, especially on the issues that we've raised, but especially on the progress of the resolutions, because we want to deal with these resolutions. Can't have a lot of resolutions that were not implemented. So from here, you must start to deal with the issues as we raised and deal with the resolutions. We spoke about the resolutions, how you must scrap the resolutions, and you will be given a date when you have to resubmit, just to respond to what we communicated earlier, so that we are able to generate a conclusion out of those resolutions and further recommend to the House as for the way forward. Because if you can just take them as they are, we'll just say they are not implemented, and then it means you have a bulk of resolutions that are not implemented. And we believe that you can do better. We believe that indeed you can move from from unqualified to clean audit, as we were able to move from qualified to unqualified. So what we want to see is where we can account for each and every cent, and we can do that by reducing the UIFW, make sure that consequence management is key, and then we report fully, so that people must not just assume based on the statements that you make without giving a full explanation of what was done up until the matter is settled, or up until the matter is complied with in terms of the legislation. We want to thank you, MEC, for responding to the invitation in the first place, and to take efforts to respond to our questions and to clarify where members had questions. We really appreciate it. We believe that indeed you have done your best. Where we have raised concerns, please make efforts to address them, and then we believe that in the next financial year we can do better. And if you remember, if you get 3 audits, it will not appear. So if you don't find yourself sitting where you are sitting as CFO, just get the clean audits. We'll just meet in the mall and greet each other. So that is the reality, because you come here because we say we do not come. But the other issue that we need to emphasize is the issue of compliance. Let's comply with everything. When we are not sure, let's make sure that we consult and then we are properly advised and implement. Because to be advised and not implement is also something else. So with those few words, thank you, MBC, and we also want to thank the chairperson of the portfolio, Honorable Malevana, and the committee, honorable members of Scopa, the staff, the AGSA, the provincial treasury representative. We thank you very much. It has been a long day, but we think it was worth it. We were able to do justice to the report. Even when we are going to write our own report, we'll be writing it on informed basis, so that we don't just do the assumption. So with those few remarks, we want to come to item number 10, which is announcement. I'm not sure if there's tea. Usually there's tea on our way. We can just grab something.